So we did the prone scan, supine scan. We got into this disafferentation where you saw using the muscles as a circuit, as a point of entry for stuff that you wouldn't find any other way. Just a unique vantage point. Like I said with the beach ball analogy, check it from this angle, check it from this angle. Because once you clear, like you guys who've been in practice a long time, once you clear somebody and they're regular patients, sometimes they come in pretty darn good. But for me, I want to dig a little bit. If I find that patient like, okay, well, let's check this. And I'll go through a whole disafferentation scan. Why is your deltoid shut off? I don't know. Let's find out. You know, and you can go into relating it to organs, nutrition, or whatever. But for me, I clear it out just like I clear anything else out. Physical, chemical, emotional, that kind of thing. So I think we'll do one quick upper body check of the C1 to T1. So I can just show you, we did the lower body, but we'll do an upper body. You got lots of upper body stuff. You want to be the test dummy? Okay. You're all right sitting here on this table facing that way? All right, cool. This is really, really cool. Really cool. Yeah, back to me. Okay.
You know I have the middle plate, right?
Yep.
Okay.
We're gonna have a hammer and a chisel to fix that plate, all right? No. She's like,
whatever it takes is what
my neck is fused. Don't touch me. But I do want to show you something because even with this kind of, because I've had people with all kinds of weird stuff. They're like, this is torn, that's torn, this muscle will never work. And we've got, I don't know how many times I thought you need surgery, like me. And I'm like the most conservative person when it comes to surgery. If I can avoid surgery, it's like, I'll do anything to help people get away from that. But there is this time, this guy, one of my first patients when I did this, his supraspinatus tendon, like one was over here, I mean it was completely torn like that, like not even touching. I'm like, his name's Dan. I said, Dan, like, buddy, you know how much of a fan I am of not surgery, but like they're not even touching, you know, like there's nothing, it's fully torn. He's like, listen, just do what you know how to do. And after however many, he said something like 8 months. He goes, give it 8 months. I'm like, all right. So I started doing this protocol on him and giving him nutrition. And within like 3 months, he's back to work, full range of motion, no pain. I mean, he could not even bring his arm out to shake my hand. That's how torn, I mean, that's how messed up his rotator cuff was. Full function, or yours returned to pretty much full function, right? Yeah, I mean, you had a, slap tear and all kinds of nasty stuff in the labrum there. So yeah, I mean, it's crazy. And that's the first time you told me that I actually did this on you. You were face down, but I was doing an accelerated version on you. I'm going to show you. Yeah, and it's nuts because the muscles turn on, the brain turns on, and when you get that connection, it makes it different. So the old pattern that you have from this injury, if she's still running off of that, she's not going to be doing well on these tests. She's going to be weak on certain functions, okay?
I have a new injury too. I fell.
Oh no.
Landed on my chest.
Don't
really,
do that.
Really hard. I know.
You know, that's the famous doctors. Don't do that. That hurts? Don't do that. All right, we're going to bring your arms up just like that. Just bend them. Yeah. And all I'm going to do is just test the strength from left to right. This is C5. What side gave out? Right. So just relax. So without overcomplicating things, let's see mitochondrial function. You guys are going to understand mitochondrial function real fast here. She has a plate back here, okay? So can I shoot this right into here? And there's a plate probably blocking,
C5.
Yeah, C5, blocking my access, that controls C5, the deltoid, blocking my access to the spinal cord. Yes. So why not hit the mitochondria from here between the scalene where C5 comes out? That's your scalene. Because you can't plate the scalene, it's a muscle. You can plate this bony spine, which protects the spinal cord, but if you stimulate these nerve roots, you're going to get to the mitochondria, which is going to influence the function of her muscle. Okay? You can. And I could fix it like that, I guarantee. But just for demonstration purposes, we'll stay on the first floor before we go into.
Can you do the disaffirmation?
You can clear pretty much anything. So what I'm going to do, boom, boom, boom. I'm going to go right into C5, just over the scalene. Okay. Now I didn't do anything regarding cause, and I can go here. Is this thing that's this disafferentation? Is it physical, chemical? Chemical. Is it outside, inside, internal? Infection? No. Chemistry? And you can list them if you want. Like in my mind, I'm going through the different quadrants. Hers is digestion. So could you, like for me, like I'm lazy again. I go, digestion starts in the mouth, so I'll check the mouth, and then I'll check the stomach. So for her, it's her stomach enzymes. I could also, if I'm really lazy, Nancy, most of the time I'm really lazy.
Or efficient.
Well, I'll go like this. I'll say, hey, there's something going on with the stomach. It's affecting this. I'll hit the stomach, because I have the stomach frequencies here. I'll hit stomach. I'll hand her the laser, put it over her stomach, and I'll leave. Dr. Jim is classic for this. He gets his staff to come and say, hey, this is what's going on. And he'll go and put his feet up, drink some coffee, do this, go mess with another patient, do some muscle testing, and come back. Oh, look, you're leveled. You're perfect. See you later. And it works great, right? So, hey, if it works and you can do it more efficiently, why not? So, I'll just show you what that looks like. Mr. Stomach, there it is. So these are just the stomach frequencies. So just don't put this in your eye, put that over your tummy, right in there. A little, you can go right there, yeah. Okay, so great. My intent, again, like we were talking, my intention with her placing that is to optimize her enzymatic function in the stomach. Could you go more detailed on your intent? The more detailed your intention, the faster the transformation, the faster her healing. Could I visualize parietal cells? Yeah, they do HCl. Could I go into chief cells? And hey, all these different cells that are secretory in the gut, could I visualize them in that little gastric pit? Did you have to do any of that for school? Okay. Okay, so do you understand what I mean? You see a picture, you can see it in your mind. So in my mind, when we harness our intention, it's like the more detail I can focus on keeps me out of, was it you that asked me about dichronicity? Yeah. Keeps me out of dichronicity. My intention is very weak when I am in a state of Nancy saying, I would rather be home, or I'd rather be on the golf course, seeing these stupid patients, right? That's called dichronicity, like your energy split, you're not with them, right? And the opposite is true. If you're loving it, like really having fun, and I'm so focused in on her gut lining and on those cells and on that, but before I even get down to the infinite detail of her gut and these gastric pits and these little parietal cells, before I focus in on that, it's already changed, it's already healed. It's crazy that that is how refining your intention works, okay? Now, what do we do? 30 seconds of me yapping, right? Right. So, and again, could I have gone and done something else? Sure. Bring your arms back up. Don't let me push. I can't budge her. And I'm pushing harder this time. Relax. So, how is that? It's plated, it's ruined, it's this, I'm screwed. No, you're not. It's instant change, okay? I'm going to do C6. You just put your knuckles like that. I'm going to try to straighten your bicep. Can't do it. I'm going to try to straighten this bicep. Easily straighten that. That's like, my 7-year-old's stronger than you. Okay? All right, now I'm just messing with her. Yeah, so
now it's not.
Here's the story. We go down one, right? We go to C6. One lower. Is it physical? It's chemical. External, internal. This time it's an infection. What kills infection? 405. So why overthink? I'm going to show you a quick scan of infection, okay? Now, let's stick on the first floor. I almost went right into what Kim does, so hang on. Hang on. getting ahead of myself here. What I would normally do is hold the intention of infection and then scan her body and see where it is, okay? But because we're in demo mode, all right, let me see. I have an infection frequency on here, programmed in. I turn it on. And for this, I will actually show you a couple cool things, okay? First thing, I'll use my rubbing plate. Okay, the reason I'm using my rubbing plate, I want to show that these fields are not active, okay? When I shine 405 on there, when I come across a field that's active for infection, it's going to squawk, it's going to blow out, right? It's like the circuit's already weak, you add that, it blows it, right? So I'll talk out loud. Thymus, lung, heart, stomach infections, liver, gallbladder, pancreas, spleen. Now what's the treatment? Watch. I'll just hold it. It's still there. It is, but she has a funny colored shirt on. So here's the thing. What's my intention? I didn't even find the type. Bacterial, viral. So it's viral in the screen. So could I refine my intent? Okay. So my intention, clearing out spleen virus. Real simple, right? Target it, destroy it, degrade it, eliminate it. Here. What happened? What happened? What happened? It's gone. Which means the immune system's all over it. And then, boom. So here's a story. Make your fist, knuckles up. Don't. I can't budge her.
It's funny, before you released that, and then before you did this, I felt the L5 begin to ache, and then you just did that, and it just went away.
Boom. It's crazy. She's sensitive to that energy shift. Some people are not. And it doesn't matter because the correction happened either way. I'm going to do C7 next one down. Put your thumbs up, elbows in. I'm going to try and pull up, don't let me.
Tried.
I know, you did good. Actually, I got a 2 for 1 deal. Oh, I just checking C7. I'm just checking her triceps. She doesn't have the strength here. She's like resisting.
I tried.
Yeah, she can't. So just relax. All right, so all I do, guys, swing it around. C7 is lower. Right. You okay?
Yeah.
All right, cool. So
You're not entering from posterior.
she has a plate,
Oh, that's
big old metal plate. Yeah, and his story is most people, yeah, you can go right from,
I was thinking you'd go, but I forgot.
yeah, because the way this looks, that's a good question though, because I was trying to explain this. You might not be able to see the purple that well, but you see how there's 2 lines? Like that straddles the spinous, and it's right where the nerve roots come out. So I actually will go posterior and hit it like that. I'll use this just to show you. So if I'm this far away from her, I mean, that's her entire cervical spine. If I want to get more specific, I can always get closer, and you see how it's right at C6. So further away, the laser won't be quite as strong with a lot of ambient light like this, but the closer you get, the more mitochondrial function you're going to influence. So yeah, I would definitely do it back there, but
And the laser specifically is of mitochondrial function.
that's the biggest thing.
What's this?
I mean, you look at the signaling pathways of the laser, they're very, very powerful, which means it shuts off NF-kappa beta, which is the chief inflammatory media of all cells in your body. So turmeric works on that level, boswellia works on that level, the laser works on that level. The laser does some other interesting things. It increases brain-derived neurotrophic factor, which is one of the causes of Alzheimer's, a deficiency in that. It releases glutathione, which we talked about that being the master antioxidant. The laser does this when you put it on a tissue. It releases nitric oxide, which increases circulatory function, blood flow, microcirculation. So I mean, if you understand the parameters of those are linked to pretty much every degenerative disease known to man, and this thing could upregulate those and shut this stuff off. And
Do you want me to take this off?
Nah.
And see the light there?
nah, you're good. You're good. Yeah, so I'm right on C7. Is it physical? Is it chemical? That one's emotional. I'm going to go through my chart, traumatic event. Take a deep breath. See, if I get real lazy, I'll go right to EFT points and all the way out. I'm releasing this particular emotion, influencing C7. You see what I mean? So I'm refining my intent. Did it work, guys? I don't know. Let's find out. Don't let me pull up. Strong. Now, I'll do C8 and T1. The reason I started at C5 because C4 is rotation, and I don't want to push on her head and see if she can resist. So I do those with just muscle testing, like C4, C3. I'll just touch it, C4, C3, C2, C1. C1 and C2 are flexion and extension. C3 is lateral bending. I don't want to hold here, push her, try and distract her neck that way. You don't need to do a muscle test like that. So C8, grip strength, curl in. I try and open her hand, and I can. I should not be able to.
That was like, oh my God.
Yeah, and I'll try and open your hand. I can on that side, but the side of her heart, now we're getting into heart stuff. Okay, C8, T1, heart. Could I be lazy, guys? Can I be lazy and go right over the heart and just enhance mitochondrial function of the heart and probably get grip strength improved? Absolutely. Could I go right over this C8 nerve root and see if it's physical, chemical? Watch, I'm muscle testing with my laser now. Physical, chemical, emotional. So these emotions, take a deep breath. I'll use an EFT point. These ones related to C8 all the way out. These emotions. One more time, deep breath. And all the way out. Now, how long is that? The reason I'm shortening my treatment times is because I'm using the 405. Penetrates deeper, faster, stronger. How do we know we fixed it? She curls her fingers around mine. I can't open her hand. So, I mean, serious grip strength improvement. Last but not least is T1. T1, you have them put their hands out and wave at you. I'm just going to get like this so the camera can see. We'll put them up here. Don't let me squeeze these together. Don't let me collapse these in. Okay? Ready? So, not surprising, C8 was there. So T1, come in, come right into T1 down here. This goes to the heart, and we'll see, is it physical, chemical, external? Hold this here for me. So sometimes I'll get real lazy.
This is the arm that was numb this morning.
Isn't that something? So it's external. External, physical and external environmental allergens. Believe it or not, I don't use that chart a lot. I do a lot of infection, a lot of internal chemistry, a lot of emotional stuff, a lot of bioenergetics. So I actually reference my chart sometimes, even though I made them. She's reacting to some kind of animal dander.
Basset hound?
Do you have a dog?
I got 2 basset hounds.
Oh, that's what you were saying, basset hound.
Yeah.
Yeah, I didn't even know. It said canine.
I gave him a bath last week. Yeah.
I didn't know what she was saying. I thought she called me an asinine. She's like,
Asinine?
you're an asinine.
Honestly, I've been paying more attention to him, and I bathed them both last
Yeah,
week. That's
I
so
got it.
funny.
So here's the story. Think about your dogs. Watch this, guys. Breathe in. Think about petting them. Do they have any oil on their fur? When you pet them, do your hands feel funny after?
Oh, yeah, they're nasty.
Yeah, go ahead. Just think about that. See what I'm doing? I'm activating pathways all the way out. I'm activating irritated circuits. And then I'm correcting them with the laser and the tapping. Breathe in, pet your dogs, smell your dogs, bathe your dogs, roll around with your dogs, rub your face up against your dogs. Big slobber, basset hound.
Do that too.
Okay. So, all right. So, let's see if it worked. I don't know. Put your hands out again. Don't let me squeeze. So, guys, that is your disafferentation. Would I do all the stuff I did on Judy And all the stuff I did on this young lady, would I do that on one visit? No way. So our practice model, so you guys can see it from a business, because I like putting the business hat on every now and again. Okay. One person. Okay. If I see 4 people an hour, that's fantastic. I like pushing 1 every 10 minutes. Okay. 6 people an hour. Okay. Is that high volume? No. Is what I'm. Well, I mean, maybe for like people doing way more of this, which means you should be charging way more for your time. Like, but for me, if I can do 1 every 8 or 10 minutes and stay focused, I can adjust them and send them out with the proper nutrients. And that's our practice model right now when I'm in the office. Okay. Let's give her a round of applause. Yeah.
Thank you so much.
We strengthened up her nervous system. On a follow-up, let's say we did that and that was a big issue for her, would I recheck the ones that I strengthened? Hey, last time this blew out, this blew out, this blew out, your grip blew out, that blew out, your tricep blew out. Now, next on her follow-up, she might only have just the tricep and just the grip. And I'll just redo those, and it might be a different layer at that time to treat. You see what I mean? And then there'll be a time, within a few visits, where everything's solid, strong. Would I stick playing around with disafferentation scanning? No. I'll go right to something else. Okay? So, last but not least on the technique, this is technique still, believe it or not, we do the systemic analysis. Okay? And this is what I'm saying as a standalone. If you just want to do a nutrition practice, this is by far the easiest way to assess somebody. It's super, 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 super fast. Okay? I'm going to use you. You've probably never had this done, right? You care that you sit here? Okay, cool. All right, so you can just sit with your back my way. Or let me see. You guys, you haven't seen, well, you might have seen it. You probably haven't seen this before. Why don't we have you lay face down, just so everyone else can see. It doesn't matter, no. I'll give you a little pillow here for your feet. There we go. So, yeah, if you could scribe, that'd be great. That'd be awesome. So, we got this guy laying here. And how many systems are in the body? Wait, I should ask him. How many systems? Like 12, 15, something like that? Yeah, something like that. Well, I mean, if you really dissected it, what do you have? You have your respiratory, your digestion, your nervous system, your lymphatic. I mean, there's only so many systems. So what I did was, some of you have seen this work before, we assigned a spot, a point, to each system, so when I check, I can rapidly go through and see if any of them blow out. When I say blow out, if you have your squawker, it will squawk indicating that is the system you must feed for the next month with nutrition. So does that make sense? So from a business model, it's a once a month model. Your patients see you once a month. They walk out with a month supply of the nutrient. Don't give them a 6-day supply, so they have to come back 6 days later and interrupt your front desk to buy more nutrition. Does that make sense? All right, so I will say the point, test it, and I'll show you kind of what this aspect looks like. So we're checking his brain, his endocrine, his blood sugar. Oh, sorry. Oh, I got to slow down. Brain is at the top of the head. The external occipital protuberance is the endocrine. I have a chart. I'll find it. Pull it up so it'll be easier. It's not. It's probably on my computer. I'll find it. I checked his brain. I checked his endocrine. When I checked his blood sugar, it's blown out. That's this glycemic point, C5. So he's jacked, reactive hypoglycemic. And he's young, so he's probably not even feeling much of this. Like a young guy like this, he's more like, man, if I go a little too long between meals, I start to get a little pissy. You know, I'm gonna punch someone out, right? Gets a little anxious, maybe shaky, maybe a little shaky if he goes for longer periods, or sometimes it disrupts sleep quality. when they're a little hypoglycemic. They get to bed easy, but they don't get that real sound sleep in the middle of the night. They get kind of little interruptions, restlessness. So whether he has the symptoms or not, that's the point that shows up. So how I would fix it, you don't have standard, well, here in New York.
Yeah.
Oh, you can get whatever.
I do, yeah.
Oh, you get whatever. All right, so I'll go through my regular stuff. All right, so my regular testing menu, Paraplex, that's what shows up for him. So Judy's going to write this down for you. Paraplex, I'll do dosing, just so you know. 1, 2, 3, 4, 5, 6. Holy moly. So 3 in the morning, 3 in the evening. So Paraplex is going to support the pituitary, the thyroid, the adrenals, and the pancreas. So 4 in 1. Okay. You don't have it. I'm going to give you a testing menu that has your Canadian. My promise to the Canadians, I'll give you a testing menu, because what I have is my favorites for each of these. Like, so if you're really in a hurry, you don't feel like testing to see which one, you do the first one on that list and it'll knock it out of the park most of the time. Okay? So Paraplex is the first one on my, when I have my little testing menu, it's my first one. Okay? All right. Does that fix them? This is more advanced for you guys. NRT. So more advanced is this. Does that fix this point by 50%, 60%, 70%, 80%, 90%, 100%? So one product, 100%, knock it out of, he's going to love this product. Okay? That's great. What if it was only 60%? Then I would say, okay, what's the next one down on my list that I can check? Because I need to get that point fully, that circuit fully fixed. And a lot of people don't do that. They either do yes, no, take the product, yes, see you later. No one says, does that get you at 100 or does that just make you strong? So that, a lot of people do that. So they'll go, so like when you do metrics, at 51%, you start getting stronger. Under 50%, that's what the difference between yes, no energetics are. Yes, no. 50%, 51, 52, 53, you start getting stronger as you go up. You've seen a muscle test where you could do a pull-up off their arm. That's like closer to 100. One that's like, yeah, that's stronger, but it's not quite where I want it. So that's what I mean. I do this all with just, where is it? So that gets him fixed. I'm going to check his cardio point. It's a T2. His gut, he's not happy in his gut. Why is he not happy? That's why. What's that, dude? Sore?
Yeah, a little bit.
Yeah. So if I'm a chiropractic student, I'm like, palpate. Hey, I'm gonna or roll them over and hug them and do a bear hug on them. But what I'm saying is whether I knew that was swollen or not, I could barely touch the point, and that shows up. So something is with his gut. And you can adjust this over and over and over. And when he comes back, every time he comes back to see you in London, that's going to be resubluxated. Why? Because it's a viscerosomatic reflex, which means it's coming from nerves being irritated from an organ, and it's blowing out this. Okay? So we know it's digestion. That doesn't tell me what. Let's just guess. We'll check the stomach, liver, so that's his gallbladder. And again, could I give him all the lists on the gallbladder? I could. Gas, bloating, burping, sometimes indigestion, sometimes reflux, sometimes you get headaches here, sometimes your neck and get shoulder and neck get tight. Sometimes you get constipation. Like I can go right through the list of, hey, this is classic for the gallbladder, right? You don't have to go into symptoms to do this work. I do it to prove to the patient they had a problem, and when they come back 4 weeks later, that's better. That's the only reason I do it, because they said, wow, you predicted that would go away. And then when I predict it, they're like, if he could fix that, what about Joey down the road that has been suffering his whole life? Maybe he can fix him. You see what I mean? People think like that. So we'll check AF beta food, beta call. So beta call, 1 a day, 2 a day. So 2 in the morning, 1 at night for beta call. Does that get that point fixed? 50%, 60, 70, 80, 90, 100. I love 100%ers. Infectious point. T9. Infections. No, none of that. And we'll check oxidative stress up here. Oxidative. Water-soluble vitamins are here in the scaps. The right infraspinatus fossa. That's vitamin C. This is vitamin B and G. B, G, B. B vitamins are jacked. He's probably under some stress. Who knows? He's going through his B vitamins. So hypoglycemic people will go through B vitamins very fast too, because he showed up as like a little reactive hypoglycemic. So my favorite one is Cataplex B. I don't know if that's what he needs. Bingo, Cataplex B. 1 a day, 2 a day, 3 a day, 2 and 2 on Cataplex B. Okay. And I know you've never done this stuff, but when you do a customized program, I want you to text me after like a few days and be like, this is what I noticed. And you'll be very surprised. Here. Okay. Did I fix it? 100%? 50, 60, 70, 80, 90, 100, Cat B. Home run. Love home run. I've pushed on the flank on the right for liver toxicity points on the right. Spleen and immune is on the left. Trace minerals right over the kidneys. Right on the SI joints coming across, that's vitamin A, D, E, K, F. There's nothing there. He's solid. It's because he took my shake. It's the only reason he's showing none of this other stuff showing up, because he drank some of the shake. All right, these are your minerals in pH, your macro minerals, your calcium, your magnesium, all that stuff. He's good. Systemic inflammation on the Achilles, he's good. So I mean, not bad. Some B vitamins, some blood sugar, some gut stuff. But that is basically the testing. You know, I was talking about how many systems. That's pretty much, that'll fix pretty much everybody. Yes, yeah, we're going to get a copy of that. So you can slowly sit yourself up. So she made a copy of your stuff.
I wrote the points down if you want to look at it on the chart later.
Oh, okay.
Yeah, now, you know that sore spot between your shoulders?
Yeah.
Okay. I want to show you, this is for more people who are more into osseous work, okay? I want to show you how fast it goes away with hardly touching you. Okay, so go ahead, face down again. Yeah. So here's what I've been doing. You were talking about the toughness approach taking a little longer. Sometimes you have to hold it there and wait, and it takes longer. So this is how I accelerate the low force approach. Watch. I hit play. I found the sore ouchie, right? I go about that close. And if I have a toughness pressure applicator, great. I typically just use the ArthroStim. It doesn't really matter, so you can use this like a pressure applicator. You know, you hold it on there. Like so, I'll find the vector. Take a deep breath. All the way out. So how long was that, guys? 10 seconds? Huh? 10 seconds, Walter? 9 seconds? Yeah. So my point is I take the laser off 10 seconds later. Now this is what I mean with speed. No impact on my body. I barely touched him. That was 4 ounces? How much was that I was touching you with? Hardly anything. It wasn't even the full weight of the instrument. How's that now? It's gone. I mean, could I get in there maybe and get like, if I really dig, maybe find a little more soreness? Not really. I don't know. That's like ridiculous. To me, like a patient to feel that ouchie and then go in, do cold laser and that for 10 seconds and it's gone. I don't know. Why not? Easy, low impact. Could you charge more for that? Laser treatment. You think you can charge more when you start telling them, I'm doing a different approach now. It's way better. We do cold laser combined with this new tonal approach, works on your nervous system and your blood flow, takes inflammation out. You know, costs maybe $10 more or whatever. I don't know what you want to do business-wise, but that's fast. That's real results. And how long did it take me in reality without talking? How quick, if let's say you knew all these points and I just went bam, 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 how fast could I have done that nutrition part? If that, yeah. I would have found the product, adjusted them within a minute or two. So this is what I mean. So those higher volume people, if you still want to do that higher volume, now if, let's say you're going to just charge a lot more and just do 1 every 15 so you're not so stressed, would I flip him over then and do maybe a scan on his organs and clear that out? Yeah, sure. But I'm just saying, you found the major subluxation, cleared it within 20 seconds, send him on his way, and you're done. Now he's going to pick up nutrition, see him a month later, he's going to be a lot better, feel better, and let the good times roll, right? All right, man, thanks. Just, you might be a little buzzed from that. When you
patient that comes in, like you see them once and a month later.
I am, because we're on a wait list through October. So it's like I can't get them on. I'll see you 3 times a week for the first month, 2 times a week. It's just not feasible. And a lot of my people are coming from 2 or 3 hours away.
And they're doing just as well. Yeah.
Just as well, yeah. In fact, I'm stretching out to 6 weeks now and 8 weeks now, and I'm still getting the same. As soon as I start seeing a diminishing return, I might rethink it, but right now I'm not. Walk around and tell me how that feels. Good. Awesome, man. Give him a round of applause. You guys ready to move past the first slide? Who's ready to move past the first slide? This is a good start we're off to here. All right. So hold on to your seatbelts. We're going to talk a little more about some other things. All right. And this is, you guys could relax a little bit on this. For some of you, this might be like, am I okay? For some of you, this might be a little bit like, oh yeah, I've heard about this. For others, it might be new. But balancing the brain, balancing the neurotransmitters is probably one of the most powerful things you can do on people. We talked about school shootings. We talked about, suicides, Kate Spade, Anthony Bourdain. These people, it's not about success. You know what I mean? It's about chemistry. People keep, oh, she sold her company for so much, that must have depressed her. If I sold my company for, I don't think I'll be depressed getting however many millions of dollars. There's something wrong in between their ears and in their gut, okay? And you can help these people. That's really what it's all about. So these next few slides, I'm going to talk about how you fix those types of people, okay? Trouble getting to sleep is typically just a mineral deficiency. And I'll give you, again, Walter and Nancy, I'll give you guys some Canadian versions of these, because those companies, those 3 or 4 companies have almost identical products to what I'm talking about here. Like Cataplex G might be labeled time-release niacin by Orthomolecular, you know what I mean? So I'll like find you something close, okay? But if you give them minerals at bed, magnesium, for instance, is a simple one to start with, they will sleep a lot better. I mean, give them a buffered magnesium. I was telling you from Physica, it's fantastic. They'll sleep better. I was talking to Alex about staying asleep. That's typically blood sugar. They go to bed, your blood sugar's fine, and then somewhere around 3 in the morning, in severe cases, people wake up very anxious and wide awake in the middle of the night and can't get back to bed. That's classic hypoglycemia. Your blood sugar drops at night, your cortisol goes through the roof, so you wake up and you're like fired up, like ready to go. So if you're getting to sleep fine and not staying asleep, fix the blood sugar. Again, that's why I put Mr. Alex here on Paraplex and Cataplex B, because they both showed up, okay? GTF is a chromium, so again, Orthomolecular has a good chromium. Physica has something called Jambola, which is phenomenal for blood sugar. Like, you can knock it out of the park with it. So there's Canadian equivalents of these products. Dioxanol is one from Orthomolecular that's a really good blood sugar. Now they make even blood sugar powders. Like if they want to do a protein powder that has a chromium in it, it has all these things like Gymnema you can get from, Gymnema is a good blood sugar product from MediHerb. You can get that in Canada. Some of the products that we get here you guys can't get there, but you can get that one. That's a killer one too, Gymnema. Low serotonin. I mean, these are your people, after you fix the blood sugar, the real anxiety people, your people who really have problems, you fix their blood sugar and they're still having issues. That's where you got to go after serotonin, okay? So they're pessimistic or Croatian. What's the difference? Now, my wife's Croatian, Nancy's Croatian, so we got a little ongoing joke that that's a signature. Negativity and pessimism is a signature for Croatian people. But you can say the same about Italians and Greeks, right? They're all hardcore. But anyway, Fear of crowds, fear of flying, heights, bridges, neat freaks, control freaks, obsessive. When they get their anxiety, they feel it in their chest most often. They get tachycardia. They have difficulty breathing. They sweat. They go into a public place and you'll see them sweating. It's not because it's hot. They're anxious. If you shake their hands are wet. It's clammy, slimy hands. I have some kids that are so bad that when they put their hand on my desk, they'll leave a puddle on the desk. I mean, they're that highly sympathetic, okay? So, know the symptoms, sugar cravings, low self-esteem, sleep issues, exercise. Typically, these people feel better when they exercise because it stimulates neurotransmitters, feel-good chemicals, endorphins, suicidal thoughts, PMS or menopausal moodiness. So these are the women that when they go through right before their cycle, they really do change and they really are dangerous to be around. Okay? Some of you guys think it's funny, but I've seen this stuff firsthand. All right, so low dopamine. There's your low dopamine guy. He knows he has a bunch of work to do. He's not going to get to it. He doesn't care. Dopamine, if you guys ever did work really hard and complete a very good task and you step back and you feel awesome, like, oh yeah, it's finally done, and you like it and you feel good, that's dopamine. So it's that task completion, that feeling you get when it's all your stuff's done and in order, you're like, oh, it's great. But the issue is they don't have the ability to get stuff done, inability to feel pleasure, they're low, these people are more depressed, okay? GABA is the other one with anxiety that you'll see a lot of. So serotonin is 1/3 of the calmative action in your brain, neurotransmitter. GABA is 2/3. So GABA is a big player on chilling people out. These are people that, again, they're real. You fix their blood sugar and they're still whacked out with panic and anxiety. You need to look at GABA, okay? Stiff, they're tight. You go touch them, it's like a rope, and they're just like, ugh. You know, they can't relax if they tried. That's your GABA people, okay? GABA. All of these neurotransmitters are dependent on folic acid and B6. Why did I give you that expensive powder, that hepatogest powder? Because it's loaded with folic acid and B6. Do you see what I mean? If you don't have the intermediaries, the precursors, I don't care how much building blocks you give for serotonin, GABA, all this, you need to have the things that drive those pathways, the intermediaries, okay? So folic acid and B6, if you guys are able to do blood tests, homocysteine is a great way to see if they're deficient. Anything over 6.1 on homocysteine is indicative of B6 and folic acid deficiency. I'm sorry, anything, yeah, over. Anything higher than 6.1 on homocysteine, yeah. Unregulated homocysteine will be over 6.1. Yes, it's my chapter on the heart. Yep.
Do both those bottles say Imuplex?
Yes.
Yeah, Imuplex is nice because it has folic acid, B6, B12. It has iron, which is another intermediary for neurotransmitters. So it's a generic way I give people, if they want to just take one thing that has all of that in it, it's just an easy way. If I'm working on neurotransmitters, I put that in the background all the time. Because if they're a little anemic, if they're low on selenium, B6, folic acid, B12, it has it all in there. Imuplex is like by far the best multi, if you had to look at it from a multi standpoint, that Standard has. Even though it's an immune product, it's so stacked with stuff. So, and then you need zinc, B2, magnesium, phosphorus, and adequate stomach acid. I keep saying acidify your gut. You need adequate stomach acid if you want to activate B6. Like I said, B6 is so important for all these different things, for preventing heart issues and homocysteine and neurotransmitters. But if you don't have these minerals and some of these other nutrients, they all work together. So again, why did I give you the hepatogest? Because it has all that in it. You know what I mean? Like, I try and make it complicated stuff like easy. You do a half a scoop of hepatigest, you've got it all covered. You know, that stuff from Physica that I put in the shake. It's expensive, but geez, for yourself, at least do it for yourself. And if you don't feel a difference, I would be surprised.
Is cat G the same as riboflavin 2? Is that the
No, it's not. Cat G is more niacin. It's more of a dilator. And it has choline. So think cat G like niacin and choline. So those two. Yeah. No, they all sounded like niacin, riboflavin, you know, thiamine. Thiamine's B1, that's more cataplex B. You know, like they're all a little weird. A lot of people just know them B1, B2, B3. You know, pantothenic acid and B5 and B9 is folic acid. Like, it's just weird. You don't have to memorize that stuff. Just take the scoop of the powder and forget about it. That's my thinking anyway. So how do you fix GABA? Are really stiff and wired and unable to relax. If you want to upregulate the sensitivity of the GABA receptor, use Kava Forte. That makes the receptors for GABA super, super sensitive to it. So the GABA that's floating around, if it's not docking, this increases the receptor site receptivity. So people will get chilled out on Kava. This is an aqueous extracted. I think you can get this through MediHerb in Canada. It's called Kava Forte. The other MediHerb product that's just phenomenal for GABA is valerian complex. It has passion flower and valerian in it. It's really good. Withania, I love these people who have thyroid issues, adrenal issues, and GABA issues. The Withania just chills you out. It's an adrenal support, but it chills you out. It protects your thyroid, protects your adrenals. It's one of those that's like a really nice product. A lot of this stuff, guys, 85% of these neurotransmitters live in your gut. So we always support the gut, pro-symbiotic. Always adjust people because you get neurotransmitter and feel-good chemicals released during an adjustment, okay? So you're always going to feel better. And probably like 6 years ago, Dr. Jim turned me on to the Fisher-Wallace stimulator, and it would blow your mind. You put it right over your amygdala, right over your temporal lobe, and it sends microcurrent through. And I can take the most wired person and chill them out and have them drooling on themselves in, seriously, 10 minutes. They're in a corner drooling in 10 minutes. And it's like, so it's amazing. So I helped start a opioid recovery. I didn't start it, I helped them set it up. They wanted to go more holistic. The guy bought 30 Fisher-Wallace units and had me come and adjust the people coming off of their opioids. So I would adjust them, they would get off the table like high, happy, put them on the Fisher-Wallace, and they just started laughing the whole time. It's like they were getting stoned. And there was no drugs. It was just adjusting and that. If he wouldn't let me do nutrition, I could probably do even 10 times better if they let me do some nutrition when they're coming off that stuff. But Jay Holder used amino acids, basic building blocks for neurotransmitters on his heroin addicts and got great results. But man, you start putting together these things that work. PMF is FDA cleared. That's what that unit is. It's FDA cleared for treating drug-resistant depression. They put it right over the amygdala and they pulse electromagnetic fields right through there. Really cool stuff.
You've seen the Light Star?
No.
That they do for brain. We've got a psychiatrist in Fort Myers that's doing that. They did a feature article in the newspaper about patients that can't take antidepressants. They're using it. It's a PMF type device.
Yeah.
He charges $30,000 for a series of treatments. And these people were giving glowing reports.
30 grand.
Yeah.
Perfect.
30,000. Maybe a series of,
Pay for your unit. One shot.
They say in one shot, yeah.
One shot, baby. That's interesting. Serotonin upregulation. Remember, niacin is a precursor for that pathway. Okay, so niacin is a precursor. They say do 5-HTP, do this, do that. Without niacin, you can't get to serotonin. And with melatonin being zapped by artificial light, when melatonin gets zapped, serotonin gets zapped. So if you want to fix people's sleep, upregulating serotonin and blocking artificial blue light after the sun goes down, that's a very good combination. It's a very powerful synergistic combination. St. John's wort, again, Minchex is like minerals. It's magnesium, and it has kelp, and it has a lot of real calmative minerals. Cataplex G, like I said, that's an upregulator of serotonin. There's your folic acid and your B12. The Nevaton Forte has been a really powerful one. Yeah, it's great. I mean, 2 and 2 Nevaton Forte chills some pretty intense people out.
I got people tell me that they can't have folic acid B12 even though they test for it because they got MTHFR,
Yeah.
and that's a synthetic.
Yeah.
But they test for it if they need it.
The story with folic acid B12, when you're getting it like from standard process, the animal does a lot of the conversion because it's liver. So they'll put it into the methylated form. The animal will do that. So you can actually get improvement, even if they're not methylating, with giving them whole foods. I find, this is my personal thing, that my people who I know are not good methylators, they can't absorb this stuff, I find like what I did with you guys where I squirted some of it in there. It's methylated, sublingual methylated versions, or Orthomolecular makes something called methyl CPG. It has all the methylated stuff in, and you can get away with 1 capsule in the morning, 1 capsule at night. So it cuts down on the volume of supplements they're taking, because folic acid B12, it's whole food. If you're getting it through like liver,
Say it is. I looked at Center Process. They researched and said it's not all whole food. Some of it's synthetic.
well, some of it might be, but you can fix homocysteine even on people who can't methylate. Even though it's not methylcobalamin, for instance, they'll still get improvement on homocysteine. But the ise is that you got to do folic acid B12 and B6 niacinamide. You got to do both of those, and you got to do a higher dose. So you're taking like 4 or 5 of the B6 niacinamide, and you're taking 6 of those. I mean, you're getting like, that's what I'm saying. You're getting to like 12 tablets a day when they can do, yeah, they can do 1 capsule. So for me, it's more like a, compliance issue where they're like, hey, I'll do that. I'll pop 1 or 2 of those a day instead of taking 2 handfuls of that stuff that smells like, what that smells like. It's like nasty, right? Fixing the adrenals always helps. Upregulating B6 always helps for serotonin.
What was that next? What was that product from Orthomolecular?
Oh, it's called methyl CPG. Yeah, that's an awesome one. I've fixed a lot of stubborn homocysteine with that. As far as our dopamine, upregulate that with Vitanox, which is green tea, grapeseed, and turmeric. Rosemary as well is in that. AF beta food, which is more liver gallbladder. Folic acid B12. Fish oil and Fisher-Wallace. Coleus helps out with dopamine as well. Now, Biotics does make mucuna purines. Mucuna purines is probably the most potent dopamine upregulator. Okay, and you want to try it out in your bulletproof coffee, buzz in some mucuna. It's called Dopatropic, is the name of the product from Biotics. You guys can get it. It's a little powder. 1 little scoop of that stuff in with your bulletproof coffee. Boy, you want to have a good day. Just drink that in the morning. It is like, I don't know. I don't do it often. I don't think I'm low on my dopamine, but I tried it out and it's like, wow. That's a game changer between the ears. That'll save somebody from getting strangled for sure. If you're having a bad day. All right. So quick fix, fixing the HPA axis. That's what the simplex formulas do. Support the hypothalamus. They have hypothalamic pituitary support in Biotics, and I think they even get it up in Canada. Some of the desiccated organs, they're like real picky. The Canadians are like, can't eat, or you can go to the store and go buy the organs, but you can't take it in a supplement. I don't know. Cataplex B. Whey Pro is really good for upregulating all neurotransmitters. It's a very wide spectrum, bioavailable amino acid spectrum. So you could take Whey Pro and get that. Cataplex B and fixing blood sugar. Those are my two favorite. Get people on protein shakes and taking Cataplex B. You'll fix most anxiety, most of the time, just by fixing blood sugar. Have them eat more often, less carbohydrates, more vegetables and good fats and good proteins. It's very good stuff. So again, 4 easy steps: fix the endocrine system, fix the blood sugar, fix the neurotransmitters, and then you can add in some herbs in your stubborn cases. I always try and do it conservative to herbal, because think about the least conservative is drugs, SSRIs. Like, that's the least, like, here, take drugs. And these people, these kids, I got kids 12 years old, 15 years old on psychotropic drugs. I mean, it's like unbelievable. So I always start with the basic. How about don't feed them sugar for breakfast, lunch, and dinner? How about take some supplements, adjust them? And then as some more stubborn cases come in, and sometimes it's they're not being compliant here on the blood sugar, so I'll have to jump to the herbal to chill them out because they're out of control. These kids are like, some of them are nuts. Easy fixes. Kids aren't that hard. I have them with people who are really, really having trouble with compliance. I will have them, Walmart carries grass-fed hot dogs now, organic grass-fed hot dogs. I'll have them boil a package of hot dogs. And when the kid comes in with the low blood sugar, they go right for sugary stuff. That's what kids do. It's like automatic. I have them just have a chopped up hot dog or two on the plate. I said, let them eat as many grass-fed hot dogs as they want first. What that does is it stimulates leptin and CCK, which shuts off the sugar cravings in the hypothalamus. I said, give them about 10 minutes and then see if they ask for sugar. They don't. So, start simple. Like, geez, just eat something other than carbohydrates and sugar. Jeez. Anyway.
The other thing, one more thing with that, it's not just a psychiatrist now. I don't know if you've seen that they're getting occupational therapists. So you got a 5-year-old kid that's getting occupational therapy. It's like, where is this coming?
That's weird.
Serious.
Yeah. It's going to get stranger and stranger, and I think that's why we need to do this kind of work, because you don't have anyone else on your side to help kids in your community, You're not going to get it at the medical doctor. You're not going to get it, unfortunately, at school. You're not going to get it. They just go through their hoops that they have to jump through. Like you said, it's all looking for money.
The diagnosis is the psychiatrist labels these kids. It's unbelievable.
It's too bad. It's sad. The cool thing is we could fix them, right? That's the fun part. And you get paid for it too, which is good. Now we're going to get into the really good stuff. We have been doing, some of you already heard the summit that we did. They basically got together like 18, I don't know how many technique people, but there was, I think, 4 technique. Gonzalez was on it, I was on it, QNRT, and Corin. And then they had like marketing guys that were just hardcore marketers. They had Patrick Gentempo, Christopher Kent. They had the guy Paul Webb with Pulse, yeah. So they had a bunch, basically a whole conglomeration do this 2-day summit. And when they interviewed me, they said, well, how do you recommend it? People don't know how to do all this stuff, and like, what do you recommend for people? So I put together, this was from Thursday, blood sugar, but I put together this package that goes with the book. So the book went out on the 21st of December of 2017, and it was a bestseller on Amazon by January. So that's a good thing. Patient utilization, I think it's underutilized. So that's what I talked about. I talked about a lot of the stuff with our technique on that thing, but highly underutilized for people doing anything related to wellness. This basically has a self-assessment tool. If you look over there, like the physical assessment is chapter 2. It's 10 questions that you would do. So there's 10 questions, they score themselves. So actually this is the nutritional stress assessment. I buy and eat mainly organic and non-GMO foods. 0 is rarely. And then you go all the way to 10, and it's very often. These are your hardcore people. So obviously they go through this. I eat plenty of high quality fats daily. Oh, I thought fats are bad. 0, I don't eat much fat. You can really get a good idea on where people are lost in regards to nutrition. Where their understandings. A lot of people are still under the old myth like low fat is actually good, believe it or not. And high carb is good, and eating fruit all day is fantastic for you. It's not. So anyway, what they have been doing, what the package was, is we have these scorecards that come out, and you get 2 hard. Now the hardbacks Amazon does not print, so I have hardbacks. For the Canadians, I can't ship. I mean, I can, but it's crazy to ship them there. So Canadians, I've just been giving them whatever the cost is for the audiobook, because it's on iTunes now, the audiobook is. But you use this in your office, and you have them fill out the assessment tools. So they'll do the 10 questions on chapter 2, chapter 3, chapter 4, chapter 5, chapter 6. Chapter 7 you need labs for. That's the genetic heart disease, okay? There's no feeling of lipoprotein A building up. You can't feel vitamin D. You understand what I mean? So you have to get labs. If you guys in Canada can't get labs, you would just skip that number 7. But the gut health, that's huge, and then the nervous system, that's huge. The point is they score themselves. 100 is excellent in each of these categories because there's 10 questions. 100% great. But you'll have people scoring at 62%, very low in a certain category. And what we did was we linked, say it's gut repair. So the doctors wanted what Dr. Camelli would do for the 90-day gut repair. And in month 1, walk 7,500 steps. It has a little checklist for them. In month 2, or in month 1, you would start clearing out the liver and the gallbladder. You would start clearing out inflammatory grains, and you would start adding extra vegetables with your meals. So they want to know like how to do a quick fix for gut lining. So month 2, you increase your movement. You continue on cleansing of the liver and gallbladder. You add in Cataplex AC, which is a gut lining repair product. And then you add in the shake. So along with their quick start program, they get one that looks just like this that has how you make the shake we made. Now obviously the shake we made here is way out of most patients' price range. So I put how you would make a basic shake, an economical version of that, okay? Yeah, real basic stuff. And then in month 3, continue on AF Beta Food and Cataplex AC. You see they're not being pulled off of products, they're building on because they will feel better and better and better each month. Then you add in the whole food fiber to the shake. You add in a good probiotic, and then you're taking out inflammatory dairy. So you want to repair someone's gut, but you don't want to sit there and have a 20-minute consult with them. They just filled this out while you were treating patients. They bring the scorecard to the front desk, and they say, the front desk, it's not hard for them to say, wow, you scored 62% for your gut profile. Here's the gut repair, month 1. Month 2, we do a reassessment. You rescore. They went from 62 to 78 first month. Here's month 2. Build on that. You're doing great. Here's month 3, and then they reassess it, and it's at 98. Do you understand what I mean? They're scoring themselves. They're taking the products. It's prepackaged. Your staff has it ready for them. And it is probably the most no-brainer approach to get the skeptical spouse, to get anybody on that. So they're like, well, you have however many, 1, 2, 3, 4, 5, 6, 7, 8 quick start programs. You have the scorecard. You have 2 hard copy books. Normally it's $4.95. We're doing it for $99. So we gave it for $99. If you guys want that, we will give you all of these quick starts and 2 hard copies. And for Canadians, I will show you the equivalent if you get these and you do this, I will plug in the equivalent for orthomolecular physica, because they have really good stuff too. It's just these ones are no-brainers for standard process, you know, AF beta food, all of that. And so that's my economical. So they'll get the basic shake recipe, you know, real basic stuff, because you're going from someone from a standard American diet to something like this. This is a huge upgrade to what they're used to doing. And then if they score poor in chapter 2 and you want to increase brain-derived neurotrophic factor and growth hormone, here's exactly how you do that. This is my little thing, like I think I was telling Nancy yesterday. If I hear myself saying the same thing more than once or twice a day, I make one of these. So I tell people, everybody has 8 minutes a week or 9 minutes a week, because this is once a week at first. And once they build up to doing 8 cycles, even 8 cycles with your rest time is only 16 minutes. You see what I mean? Like, everybody has 16 minutes once a week. So anyway, really good stuff. This is what you would do based off of the chapter 7 for the genetic heart. You will see that these all correlate. Homocysteine needs to be at 6.1. So you will have their actual lab value. So if you're in the United States, guys, non-Canadians here, you would go to Professional Lab Co-op and get an account with them. They will give you the price of a physician's price, okay? And that physician's price, like for homocysteine, is $25. So they would pay your front desk for the script. They would go get their blood work done, and you get the results in 2 days. So when they come in, you have their results, and you say, hey, you circle the one where they're screwed up on. Now, sometimes they'll be really crappy on vitamin D and crappy on homocysteine. You can do them simultaneously if you want. But some people, they'll pick the worst of the two. They'll fix that, retest the blood, see the homocysteine go from 12 down to 6. Now that that's fixed, they'll knock out the vitamin D protocol. Now that that's fixed, they'll go into lipoprotein A. Now that that's fixed, they'll go into that. So it's very non-confrontational, because they're basically doing a self-assessment tool. They're qualifying themselves for the problem, because it's real clear you scored 0 and you didn't realize that. I do drink out of Keurig every day. It's plastic xenoestrogen. Oh, I do drink out of Keurig. What's that mean? What's that mean? Drinking out of Keurig. Oh, I do that all the time. You know, it's in my break room at work. Great. They're honest. They assess themselves. You suck with the toxin load now, and here's how you fix that, right? Well, anyway, this is my presentation for that. But if you guys want that, let me know.
Can you put your basic protein shake recipe?
Sure. Right there. And that is like super, 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 super good tasting. You guys are talking about things not being sweet enough. I mean, that's like too sweet for me. I actually cut the banana in half. I'll freeze the banana, cut it. Oh, frozen bananas cut in half. I'll do a half of a frozen banana for patients who aren't used to, they're really used to eating high, sweet, sugary stuff. I mean, that's a sweet shake. You don't need to add anything with that.
John, do we get this?
So I'll pass this around. This little quick start. Find it for you.
Is the banana in there to make it sweet? Is that it?
Yeah.
So would you use like green banana? Because green bananas are supposed to be good resistant.
Yeah, I mean, you can alter it all you want. Like, I usually start with this if they've never done anything other than the sugary smoothies at the whatever tropical smoothie shop. They're used to that, like ultra sweet, fruity smoothie. Then I start with a small organic banana, and then if they're okay with that, you cut the banana in half and play with that. If they're still okay with that, you take the banana out and you squirt some liquid stevia in and buzz it with ice, and it's still sweet and still tastes good, and there's no sugar. There's nothing that's going to cause blood sugar fluctuations. It's a good question. I don't think green bananas have less. I think regular bananas have more lectin. But The only thing I have on this, guys, it says cracking the code books, $398 for 24 books. You just cross that out and you would say feature bundle, $99. And you get all 8 of those quick starts, the HIT training, the shake, 2 hardback books. Obviously, if you guys do that today, you would take the hardback books with you. I wouldn't ship them to you. But the other ones, I would actually just give you a real clean PDF of this. That way, if you do printing and handing out in your office, there's some offices that are actually printing these and laminating, and they're actually making it a 90-day program that they purchase up front. And they have a nice laminated chart for the shake, nice laminated chart for how to detoxify properly. Everything's nice and clean. It's like a package, and they get it, and they get their nutrients like in stages, you know. So you can play with whatever fits your practice model. Yeah. Oh yeah, yeah. You can play. You can edit those. Oh yeah, yeah. I have the what's the format? Not PDF. You can't edit PDF. Actually, you can get a converter and edit PDF, but I have a format on there that is non-PDF. Yeah, you can just go in. Yeah, something like that. You might not see the pretty fruits and vegetables on there. You might have to add in your own little leg. Yeah, she could probably do it in her sleep. Yeah. Anyway. On this other thing, so that cracking the codes on the back here, all of this other stuff, people were asking how we've changed our training. We've actually changed online, and we're coupling it with DVD and online. We're doing both. So that's the new bundles for Business Mastery. This little bundle that I just talked to you about with Quick Start, this is not on there, but we'll if you cross off this and just put it on there, we'll get it to you. Some of you were asking about our new talks. Show you what they look like. This one is for metabolic syndrome. So diabetes, hypercholesterolemia, and obesity. And it shows you, they're all like this presentation Zen. So you get the PowerPoint. It is editable. So if you want to add a few slides in on whatever you're into, you can add them in, but this template is there. It comes with me. So you get one that's blank like this, where you can just plug and play and just talk. You get one with me lecturing in the background. So you hear what I say on each slide. So it's a narrated PowerPoint. Hey, if your insulin goes up and your blood sugar drops, then cortisol follows, and here's what the symptoms are. You'll hear me talking about. So if you don't know, like sometimes they have like your assistant doing these talks. If they don't know like a lot about, this isn't enough to prompt them, listen to the one that I do, have them take notes on the narrated one, so when they give the presentation, they have some understanding as to how it affects your adrenals or whatever. Shows you how to do basic measurements to determine your risk factors for Alzheimer's and heart attacks, your waist to hip ratio. It shows you the 4-to-1 ratio I talked about with veggies to protein. Shows you those genetic heart factors, some of the metabolic factors there, ratios, because people don't know how to interpret their blood work.
Is that one in with that $99?
No, this is our patient empowerment. So this is what we did. We bundled them into like metabolic, environmental toxicity. These are like educational ones. So this is more like patient education. And I was telling, I don't know who I was talking to in the break room. Here, you guys could pass them around. I don't know who I was talking to in the break room, but as far as building a practice, when we were bringing on new associate doctors to fill their schedules, I would do a talk. I would do one talk a month. So February is when Valentine's Day is. I would do my heart talk then. All my pre-existing patients, I will tell them all the benefits. Every time I adjust them, here's the benefits of this month's talk. It's on next Tuesday night. Go sign up, bring a guest. Bring 2 guests, but make sure you have enough space and write down how many you're bringing. So they would end up bringing 4 or 5 guests. They would get a summary of my slides. My patient would actually get a booklet that had all 12 months, all the topics in there, and they would actually get a copy of all this information. And then the guest would just get a 1-page little summary page. So and then you just throw in a little coupon on, hey, if you sign up tonight, your reeval or your initial is, I don't know what what you guys charge for initial consults. Say it's $195, you get it for $99. $199, you get it for $99. You take $100 off the initial consult because Judy brought you tonight. It's in your little packet, so it's actually clipped there, and it actually has an expiration date, a very tight call to action. You don't want to just leave it open. Oh, I'll just use that coupon whenever you want. No, if you sign up tonight, Austin's going to sign you up. We have 3 spots next week. Just tell them if you want morning or afternoon. And literally, you close like that. So if you have associate or your practice, you want to build it more into this, this is how you do it. You do the presentation. It talks about metabolic training. It talks about HIIT training. Talks about how it improves insulin sensitivity. 59% in 1 week. Take the first step. Shows you how to go over and scale away from fruits and into more vegetables, taking pastas into spiralized zucchinis and all of this. Just basic transition steps. People don't know, hey, eat better. Okay. You don't help them. You got to show them how to eat better. Show them how to reduce stress, detoxify, and that, I mean, that's pretty much the slide. I mean, they're about 30, 40 minutes, short little tight talk, and they're all professionally done like this. You also get a newsletter that has all the research in there. So if you want to put your office logo on the top, it has all the research on metabolic syndrome embedded in there. All you got to do is put your office info there. So you have a newsletter that matches the theme of that month. It have a sign-in sheet on your front desk, and you tell your patients, bring their friends. People, how do you become weightless? Do that. Simple. Simple. I mean, anyway, that's just my diabetes metabolic one. But we have 24 different topics, and you'll see how I bundle them in there for the empowerments. So I have one just on the thyroid. This one here that you see is on sugar cravings. I have one on it, so I talk about leptin, ghrelin, and CCK, how to go more ketogenic and shut off your sugar cravings. And you know, it talks about supplementation, talks about what it means when you're craving Rockstar energy drinks and Red Bull, what that means. It's a core adrenal weakness. If you're craving wine and beer, it talks about the candida test you can do. You spit first thing in the morning. If your spit grows legs like that, you got systemic yeast and candida overgrowth. That's why you're craving wine and beer so much. So it's real practical, the talks. The talks are set up to get people thinking, oh, you know, that sounds like me. Maybe they can help me. And if they're a guest there and they don't know you, it's really cool because then they get to kind of feel you out. Like, oh, you know what? I always thought holistic people were kind of wacky. That made sense, you know? Whatever. It's like an interviewing process. Now, once you're waitlisted, if you do the talk and you have guests, remember, you can always be like, normally the first year of care, so if you want to weed people out, normally the first year of care is about $3,800 out of pocket. So if you're thinking your insurance is going to cover everything, you're probably not in the right place. So that's what I do when I was way back when I had my front desk doing the talk. I would have her literally throw a modest estimate out so you could see who went, oh, I thought my insurance was going to cover, and we would literally send them to someone else. Like, not even waste your time in a report of findings. Like, don't bring the people in who aren't a good fit for your practice. Do you understand what I mean? That's when you're a little more selective. If you're just out of school, man, take them all. You know what I mean? Like, take them all. You got to pay off your student loans. You got to help people. Take them all. So if you haven't heard, this guy published, well, he did multiple studies, but first human studies on reversing Alzheimer's. So, last 30 years, zero cure, everybody dies, everybody degenerates, it costs a ton of money, it's horrible to watch. This guy's reversing the last 450 patients, full-blown Alzheimer's, he reversed every single one of them. How he do that? Well, we're going to go over how, and I'm going to show you the protocols, and this is like the bleeding edge of cutting edge. Now, if you guys have all heard this, I would be very surprised. Let me know if you have. So that's the Journal of Aging, and they did a poll. It was the most read article in their history of that medical journal. This is the most, I think he was in the 99th percentile as far as hits on people from all over the world contact. He has this place called the Buck Institute. He's a medical doctor north of San Francisco, California, and he basically takes people in. He checks 36 parameters. So how he disproved that Alzheimer's drugs don't work, they're a monotherapy. What that means, they'll block one pathway, like beta amyloid production, and they think that's going to fix everything. And what he's saying is, over the last 30 years of neuroscience and research on the brain, there's 35 other holes in the roof that are leaking like crazy, and you think plugging one's going to fix it. So I listed some of these here. Low brain-derived neurotrophic factor. What did I just give you in the quick start? High-intensity interval training will massively increase brain-derived neurotrophic factor. If you don't believe me, there's a guy named Dr. Ratey, R-A-T-E-Y. He wrote a book called Spark. You guys have ever heard that book? Spark. So it's basically a Harvard MD. He said, what happens if we take these kids over in Illinois, this school district, and have them do hardcore movement and exercise an hour a day, every day? Like, forget about PE classes where you're like learning how to touch your shoelaces. He's like, we're going to put heart rate monitors on. We're going to like work these guys. They went from scoring 16 out of all the world in math and science down to number 2. No new anything, no new skills learned on an academic level, just increasing brain-derived neurotrophic factor, better synaptic firing. So they retained better test scores. I mean, it was just crazy. So he did that. Bupleurum is about the only herb that I've seen that comes close to that. Bupleurum is inside Livton, liver tonic. Bupleurum is an herb. 5-fold increase in serum brain-derived neurotrophic factor. Guess what else turns brain-derived neurotrophic factor on? 635 nanometer cold laser, helium neon, basically this right here, turns on increases brain-derived neurotrophic factor when you shine it on people who have brain injuries. When I say shine it, it goes through the skull. You guys haven't seen how powerful this is. I can put the light up here on your forehead. You'll see the light in your eyes. I mean, it's crazy. Like, I'll go up into kids' throats and sinuses, and you can actually see it coming through, their cheeks. I'll do it this way, and you open your mouth, and your whole palate will be lit up red. I mean, this stuff is wicked. Guess what, guys? Number one predictor of Alzheimer's, or fuel to the fire of Alzheimer's, is increased blood sugar and insulin. So in our neck of the woods, we call it hemoglobin A1C, fasting blood glucose, fasting insulin. What he's saying is pretty much what we've been testing on people's fasting insulin. You need to be under 5 on fasting insulin. I mean, I see people even on metformin, on drugs, diabetic drugs, and their fasting insulin is still 25, 24. So under 5 on fasting insulin. Hemoglobin A1C, brain, the hippocampus will atrophy every single year, which is the hallmark for Alzheimer's, if you have an elevation in hemoglobin A1C, which shows you how your blood sugar has been for the last 90 days. So 5.3 and below, 4.8 to 5.3, you have 0 brain atrophy. When you start going above 5.3, like if you're pre-diabetic, 5.8, 5.9, your brain atrophies quite a bit every single year that it's up like that. They call that advanced glycation end products. And that's what insulin does. It ages the endothelial linings, ages the brain, atrophies the brain. Homocysteine does the same thing to the hippocampus. When you're over 6.1, you will get hippocampal atrophy. And the likelihood of you dying from a heart attack or stroke before you have Alzheimer's is very high. So the heart attack or stroke will take you out. I've tested people homocysteine all the way up into the 20s. 21, 22 is the highest one I've ever seen. But most people walk around, I feel great, I'm healthy, I'm happy, and they're walking around with a homocysteine of 14.9. And I'm like, buddy, 6.1, anything over that, your risk goes up a lot. The Journal of Cardiology said every 3 points you're above 6.1 increases your risk of dying by 35%. So if you go in at 9.1, 35%. You go up to 12.1, that's 70% as far as heart attacks and strokes. We're not even talking about Alzheimer's. So in my chapter on number 7, it's genetic heart disease, but this guy released all of his stuff after this, and I was like, man, I should have said genetic heart disease and brain degeneration if I would have known how vitamin D. So that's the next one. Low vitamin D increases beta amyloid plaques. In men, low testosterone increases beta amyloid. Now, free testosterone versus total serum, those are two different things. Free testosterone and beta and total serum, you want to be over 500 on the total serum testosterone for men, okay, if you're doing labs. And the free testosterone needs to be over 7, close to 12 or 15, so the higher end. So a lot of people are low on testosterone. I already told you about stealth pathogens. I let the cat out of the bag early on that one. You have stealth pathogens, they'll get into your brain and it will produce amyloid. Yeah.
Free testosterone above what?
I think, I don't have that one memorized. 6.7 to 15, I think, is the range where you want it to get out of the danger zone for Alzheimer's. Heavy metals will increase. You know, they said the mercury fillings, they won't harm your brain, and they're wrong. It does.
Do you have any idea how he is measuring those?
Blood. Yeah, he uses a lab for some of these called Cyrex, but through LabCorp you can do a lot. Through that co-op I'm telling you about, you can do a lot through that LabCorp. Like they do fasting insulin for $5. They do A1C for $14.
Yeah. But I mean as far as heavy metals.
Oh yeah, he's using Cyrex labs. Cyrex. They have an array. That's all of Cyrex is array 11 for heavy metals, or array 9 for leaky gut. So he uses Cyrex. They're a little more sensitive to autoimmune brain disorders.
Because you know, I've always heard that it's hard to gauge the heavy metal load.
Yeah, it is. Like I have doctors that will use hair, like through doctor's data. You can get some idea of hair. The one that I use sometimes is hair with the minerals, because if your gut is wrecked, all the minerals will be on the malabsorption and all the metals will be through the roof. So that's why, like, he's talking about ratios like copper to zinc. Like zinc, most people are depleted. Copper's through the roof. You will get neurodegeneration if you have an offset of zinc to copper. So you want it to be like 1-to-1. And you see these people really skewed. And that's simple. That's a serum test. Serum zinc, serum. And you can also, LabCorp does intracellular inside the red blood cell. They'll check nutrients in that. It's a little expensive even through LabCorp. So you're better off getting like a Cyrex that does the whole thing for a certain chunk. But elevated homocysteine, mold exposure. But here's the takeaway. Amyloid is not the bad guy. It's just a defense mechanism. Yeah, that's the big takeaway. They're trying to, well, stop amyloid production with drugs. Well, why the heck is that? Amyloid's trying to wall off an infection that's going to eat your brain alive. You know what I mean? It's not amyloid. So anyway, I'm excited about this stuff. So let's keep going. This is about as simple of a breakdown as you'll get. Neurodegeneration, infectious agents, these are the contributors, toxicity, and leaky barrier membranes. Obviously, if you have crappy blood flow and anemia, which means you don't have enough red blood cells to deliver oxygen to the brain, that's obviously a bad thing, okay? A lot of people ask how you do that. We use a pulse ox. Stick the pulse ox on. They should be saturating high, 99, 100%. If they're low saturation, not good. The little Luna on your fingernails, if you have poor blood oxygen, everybody know what the Luna are? No?
That little
White moon? Yeah. So your white moon, you got one there, you're good. You got a little bit of adrenal issue there.
What made you think of adrenal issue though?
Oh, he had a pinky Luna. You shouldn't have them on your pinky. So, should not. So a thumb is your fattest luna, the white ring down there. Next one is your index, your middle, and then the smallest one should be on your ring, and you should have nothing on your pinky. If you don't have luna, you have poor peripheral circulation, poor nitric oxide, okay? Poor microcirculation. Now, the other thing that we see is people who have chronic toenail infections. Fungal infections under the toenails are classic for poor perfusion of the extremities because you don't get blood and you don't get the immune cells to go in there and pull that infection out. And guess what else is far away other than your fingertips and your toes? What's the furthest thing from your heart? Your brain. So if you're having these symptoms here and there, your brain is hypoxic.
You're saying people that have a luna on their pinky.
They're more towards high blood pressure, adrenal. They're the spastic and anxious ones. You'll see that. And then you have the opposite. Some people are so stressed that they're just vasoconstricted. They have no luna at all. I have guys coming in here with nothing, like not even on their thumb. I'm like, you don't have luna on your thumb? That's crazy. So, got to fix that. I would upregulate nitric oxide through high-intensity interval training. Anything that raises the heart rate will secrete nitric oxide. Raw beet juice does it. AF beta food does it. And then I would also do real basic heart support. So I'll do like Vasculine. Vasculine's like one of the fastest ways I grow people back. Cataplex G couples with Vasculine. Vasculine is like Cardio Plus with the B. And so I do the complement. So if I have them on Cardio Plus already, I'll add the Cataplex B. If I have them on Vasculine, I'll add the G. So I'll do those. And then if we want more peripheral circulation, sometimes you can do things like I was telling you about with the raw cacao powder, things that stimulate peripheral circulation, like cayenne, that kind of thing. The blueberry powder is inside that powder we put in our shake. So, I mean, that's pretty much, this guy did 36 things. This is pretty much what it is. It falls into these categories. In fact, he categorizes Alzheimer's into 3 groups: hot, which is an inflammatory; cold, which is an ischemic; and toxic Alzheimer's, toxicity, heavy metals and molds and all that. So they all have different characteristics, the 3 subtypes. All Alzheimer's will increase if you have ApoE3, ApoE4. It's apolipoprotein E. You get 2 from your mom and you get 2 from your dad. I happen to get the broken ones. I got E4, E3, which is almost the most dangerous one you can get. E4 is the most dangerous. E3, E4 is the second most. If you have like E1, E2, you have a force field around your brain. You'd have to do really dumb things to get Alzheimer's. You know what I mean? Like go into full contact fighting and get kicked in the head over and over again, and go drinking and go do all the wrong things. But my point is that E3, E4 and E4, E4, it's a $56 test at LabCorp. They'll check your genetic profile right through the blood. You have that, you better know you have that, because then you better behave yourself with these other markers. You understand? It's like a loaded gun. You could sit there and screw around with the trigger with the safety off, or you can say, holy crap, I got a loaded gun. I better watch my homocysteine. I better watch my vitamin D. I better get my diet clean. You know what I mean? I better keep my sugars down, and I better freaking move and exercise. You know what I mean? So,
What test is that on?
Apo, yeah, Apo.
No, I mean on
LabCorp.
I mean the professional club. It's genetic.
No, it's not genetic. It'll say apolipo. You know what? They changed the name. It's actually called Alzheimer's Risk Assessment. I think it's called now. Yeah,
Okay.
It's like $56. It's great. Shows you whether you got it or not. It's awesome. Because there's no way to tell. I mean, yeah, I had a bunch of Alzheimer's on my mom's side and dementia on my mom's side, and you know, my dad had a lot of the cardiovascular stuff.
Yeah.
So.
And you said there was hot, cold, and
Toxic.
toxic.
Yep. Toxic on MRIs, they do volumetrics to see how the volume is in your hippocampus. Toxic will show shrinkage globally in the brain. The first 2 show just hippocampal atrophy, which is like classic Alzheimer's, right? So you get atrophy of the hippocampus. The other ones, it's like a global shriveling, the toxic Alzheimer's. So obviously you got to fix detox pathways and get people to chelate and all that stuff. So let's break it down into the basics, because we take 36 things. We're going to break it down just into those 4. If you fix those 4, you'll address it all. So leaky gut, leaky brain. How do the pathogens get into your brain? If you get sick through your nose and mouth, how do you think it gets from your nose and mouth into your blood, through the blood-brain barrier, through your gut lining, into your brain? You got leaky barrier membranes, okay? So leaky gut's a big deal. We talked about the plant paradox with Dr. Gundry, showing that lectins could pry open that. But there's bigger things. Lectins have definitely contributed, but you got to look at NSAID use. That's the biggest thing to drive home leaky gut. That's like taking a stick of dynamite to your gut lining, okay? So people are like, well, I can't have a cashew, but they're popping Tylenol and Advil. Like, don't worry about your damn cashew. Stop taking NSAIDs. Get on something like Salagesic or some kind of natural Inflammablocks at Orthomolecular. That's a killer. Awesome to help people get off of pain that are chronically inflamed.
Which one?
Inflammablocks. It's expensive because it has Chinese skull cap. Zonulin gets released when you eat. Lectins, especially gluten. Here's Roundup. That's a tight gut lining. Here's 16 minutes after Roundup. Massive gaping holes in your gut lining. So not good. So people are like, why? Should I really pay a little extra and get organic food? Yeah, you really should. Should I care what my cow's eating when I have my steak? Yes, you should care what your cow's eating, because if your cow's eating Roundup Ready corn and soy, which most of them do, unless they're grass-fed and grass-finished, you're getting Roundup in the meat. And you're also getting lectins in the meat, okay? So that's not good. Bile stagnation, pathogens, low stomach acid, drinking chlorinated water. You know, I mean, what more do you want to destroy your gut lining? You know, like, it's like the perfect storm. We already talked about having an ultra-sterile environment. Everybody's sterilizing with wipes, everything. Their grocery carts, they're sterilizing. You touch somebody, let me go wash my hands with antibacterial soap. Like there's no way to strengthen your barrier membranes when you're sterilizing everything. So we get a lot of kids that their immune system's so weak, so fragile, because the mom's a OCD. Yeah, germaphobe. It's crazy. So obviously, electromagnetics causes the growth, just like cortisol causes dysbiosis and SIBO. Electromagnetic pollution causes yeast growth. Wherever you put that electromagnetic field on you, you have a cell phone and you have it sitting wherever these people slide it. If it's not in airplane mode, you are going to harvest harmful pathogens in your gut. You're going to give them Miracle-Gro. The EMFs act like Miracle-Gro. So don't put your phone against you unless it's in airplane mode, okay? Gut-brain axis. Remember, they're finding infections climbing up your vagus nerve into your brain. Your gut infections are migrating up your vagus nerve and getting into your brain. That is the connection. Vagus nerve. It's a rope climbing contest for pathogens. It's in your gut. And they're like, yeah, we're going to make our way up to the brain and make a home up there. Okay? So remember, gut inflammation equals brain inflammation. 40% of all dopamine is in the gut. 85% of all serotonin is derived from the gut. So we talked about neurotransmitters. You better fix the gut if you want people's brains to work right. So the sway test. Simple test. You ask how we sell so much turmeric. Jeez, so easy. I basically, you guys know what a balance pad is? From Airex. It's a blue squishy pad you stand on. I'll go grab it here. But you stand on this pad, you tuck your chin, and you shut your eyes. Now, I don't have inflammation in my brain. If I had inflammation, I would sway to the side of cerebellar inflammation. I shouldn't pick on people. I'm going to pick on.
What's the pad?
It's called an AirX.
A wobble?
Yeah, yeah, it's like a little squishy wobble pad.
Cushion,
Yeah, yeah. So I'm gonna have you stand. I'm just gonna check you, see if we can get you. Turn around, and then put your feet together and face that way. So feet have to be together. Tuck your chin and shut your eyes. Good. You see him sway? He went. So it was right. Now the reason I use the balance pad is because it accentuates that. So let me grab it. This is a balance pad, AirX. Just stand and face that way.
He leans towards the inflammation, is that what you said?
He'll fall into the side of inflammation of the cerebellum. Tuck your chin, shut your eyes. See that?
Wait, do it one more time.
Yeah. Do it one more time. Bam! Smash my camera guy. If you want him to do it one more time, and you don't have an AirX balance pad, I might even be able to elicit inflammation in my brain. This one's much harder, okay? So you tuck your chin, you shut your eyes, and then you do the heel to toe, the tandem gait, okay? So first, before you shut your eyes, like, have people, like, be careful, because people are so inflamed that they will fall. Like, you don't want to hurt somebody. So tuck your chin, keep your eyes open, just heel to toe, no big, shouldn't be a big deal, okay? You shut your eyes, you take this part, it's all cerebellum, it's all proprioception when you shut your eyes. If you have inflammation in your brain, you will topple off to one side when you're walking, okay?
Does the difference in the side matter?
Yes. Well, depending on what you're doing. I shouldn't say that. For instance, when I demonstrated this, when I taught a couple months ago, they were on back order on turmeric forte. And someone had some. I had them put it under their tongue, and immediately, no sway. So in that case, no. They sway to one side, you put turmeric under their tongue, shut your eyes, they don't sway. Fix. Get them on turmeric, send them out. So G-lymph system, this is a big deal. When you get into deep restorative sleep, that sucker is going, the G-lymphs, all those little glial cells are going to go into a shortening, a contraction. They'll literally shrink around the neurons, and it's like wringing out a dirty rag. It gets rid of all your metabolic waste in your brain. So and when you sleep, it goes into a cleansing. That's what the G-lymph is. And every brain degenerative disorder will have dysfunction in G-lymph. Okay, which means they're not getting deep restorative sleep. Their brain isn't going into that ringing, and even if it is, Paolo Zamboni from Italy, who's a neuro and medical doctor, a neurosurgeon. His wife had multiple sclerosis, and he wanted to figure out why. He did a dye study of the jugular veins draining the brain. Because remember, we're bringing oxygenated blood up with the carotids. Remember, it goes through its whole thing, and then it drains through the jugulars. Stricture in the jugular. Metabolic waste cannot escape. He went in, obviously he's a medical guy, he went in and popped a stent, opened the strictures, MS went away. And he repeated it over in Italy, over and over and over on all these different patients. Found the stricture, popped it open, bam. So, back up a second. How do we fix G-lymph? We can't surgically go in through the groin and throw a stent up, and you adjust their neck. And what I do is I test the metrics. You're going to stand, and I'll test the metrics. So, metrics, quantum integration. You want to sit or stand?
That's fine.
Okay, you're good.
Yeah.
So I test the metrics. So I'm checking blood flow to the brain is fine. Notice what I'm doing here, right? Blood flow to the brain is fine. Drainage, I get a block when I do drainage. I do percentages. Optimal function is 100. Is he at 100? No. Is he below 50? Yes. 50, 45, he's at 40. So notice this is the right side in the jugular. Again, more advanced stuff, guys. I'm going to keep throwing it at you. Okay, I come right in over the jugular vein. Okay. Is this blockage draining the brain? Is it physical, chemical, external, internal? Infection? No. Chemistry? Yes. Immunological? Could we look at autoimmune, autoinflammatory, optimize immune, and brain immune? And remember, the glial cells act as the immune soldiers of the brain. And you're going to see on these things on reversing Alzheimer's, when they get over aroused, it's the hairpin trigger guard, and there's 10-to-1 ratios, which means they shoot everything and anything. They spin around. Bam, 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 bam. What, did I hear a noise over there? Bam, 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 bam. And they kill neurons. So that is called glial cell priming, where they're in spaz mode is what I call it in my notes. Spaz mode. You know what that is, right? Like, it's spastic.
Do you have both of them?
No, this one's not bad at all. This one needs some help. So immune, immune, immune. Take a deep breath. So I will show you what I would do. Aside from, I'll check the thing now. Wow, it was not good. It was 45, 50, 60, 70. He's at 80% improvement. Thoracic duct, this is going to be sore. This is his lymph. It has to drain somewhere. Deep cervical lymph nodes I cleared. Has to drain into the big thoracic duct. Ouch. Breathe in and out. Open the thoracic duct. There's two of them. This one was more blocked. Okay, breathe in and out. So I'll check 80%, 90%, 100%. Clear the G lymph.
Thank you.
Thank you. If you don't have the percussor and you want to manually strip the deep cervical lymph nodes, it doesn't hurt because the lymph nodes are very, very soft. You take your thumb. I usually use a homeopathic ointment or coconut oil. You start at the base, the mastoid. You come in front of the SCM, this big muscle here. You come in front and you just drain like that away from the head. And then you go behind it. There's a second cervical chain. You go behind it and then you clear the lymphatic thoracic duct. Do the same thing behind, in front, thoracic duct. So yeah, adjust them, do this, do that, clean this, give them the right nutrients. Another one, if they're really stiff and their lymph nodes are congested, Conjuplex at a high dose works great. Another one, clear out the lymph.
You've had me suck on echinacea before.
That's fantastic. Echinacea, Thiamex is good, sesame oil is good, trampolining is good. The PMF for lymphatics is ridiculously good. Passive. I had a kid with complete venous reflux disease in his leg. And I mean, this kid, if he didn't wear support hose, his legs would turn black and they would swell out. Got diagnosed when he was 12, no surgery. Yeah, he came to see me when he was 16. 1 PMF treatment, 1 bout of nutrition, 1 adjustment, reversed. And that's been 2 years. So crazy. He doesn't have to wear pantyhose in the winter or in the summertime anymore. This kid was so embarrassed to go to school because if he had to wear shorts, he had to wear these compression hose. And I'm just like, wow, what kind of impact is that on that kid? So the vein, the tone of the veins got better. I put him on nutrition, adjusted him, and put him on PMF. Really cool. Obviously, sleep quality is going to be huge for draining the lymphatics. You got to get him into deep restorative sleep. How you do that? Manage blood sugar, get him on good minerals, basics of sleep. Biofilms. Any leaky gut would not be a good talk without biofilms. All right. So, talked about stress hormones, but ochrapepsin E3, that's like your biofilm go-to. Clears all the mucus off the microvilli, allows you to get much better absorption of nutrition. Golden seal tablets and garlic forte, those are killer combinations. In biotics, beep, 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 protocol for biotics. Dysbiocide and FC-cytal. That will do the same thing. Okay? Dysbiocide and FC-cytal, 2 and 2. So if you don't have Mediherb, if you can't get Mediherb Garlic Forte or Golden Seal, do Dysbiocide and FC Cytal. Has a lot of the same dissolving effect. Okay? Gut Flora Complex is another phenomenal one from Mediherb. Enteric coated oregano oil with andrographis and anise. It's phenomenal. It gets past your gut and then disperses down where all these films are, and it's awesome. But I have multiple steps. You know, once you clear that crud out, you can check parasites. These guys are doing some real cool work with parasites now. You could clear yeast. And then once you strip the biofilms out, you're left underneath there with a weak, thready gut lining. Go into gut lining repair after you clear all the biofilms out. Do it in an order, a logical order. Clear this out, see what shows up next, clear that out, see what shows up, clear that, clear all this crud. When there's nothing left to clear, give them Enzicor, give them Glutashield, give them things to heal and repair the gut lining. Does that make sense? Like strip all the crud out, but man, it's been covered for who knows how many years with this film. So sometimes common sense. On Alex, we found this point showing up between his shoulders. Gas, bloating, sluggish bowels, pain between the shoulder blades, basal headaches, hard pebble-like stools. A lot of people think, yeah, I poop every day, but they're like little hard rocks like that. That's a bile stasis, biliary stasis. You got to purge the bile ducts. Okay? That's a gallbladder issue. There's your gallbladder protocol. How does that work? It works like this. 3 and 3 the first month. You see how I say add choline, don't get off AF beta food? You're doing what's called sequential upregulation. So you're building, purging it deeper, purging it even deeper, purging it even deeper. You're getting deep, deep, deep when you do 1 month, 2 months, 3 months, 4 months. A lot of people classically will put someone on, they feel better, they take them off. Like I did that when I first started out. Oh yeah, oh that's better. Let's get you on this, and I abandoned that. Well, hold on. How long has that GI system been freaking dysfunctional? More than 8 months, right? Whatever this, or 6 months. It's been messed up a long time. Why would you start the healing and then pull it away? Especially when you know the stuff that worked. Like you know that worked well. Like why would you take them? Like I don't take people off of stuff when I know it's a deeper problem. I'll go after it. Okay. There's the point. There's the chart I was telling you guys about. I was trying to find it. So this is like the no-brainer, guys. Find the point that's weak. Here's the stuff you do to fix it. Dosage. Like people try and reinvent the wheel. You don't have to do that, fix that. Now for the Canadians, like I said, I'm going to do one where I put favorite Canadian products. Okay? Does that sound fair? Do you have an excuse not to double your practice just by doing nutrition if I give you a cheat sheet? The guy I learned from did it 33 years. Do you think what I'm going to give you is going to save you 33 years? Everybody say yes. Canadians say yes. Eh? Eh? Come on.
On that systemic inflammation,
yeah.
So now you could put the turmeric in there too.
Yep.
This was made before the turmeric.
Yeah, same thing with the oxidative stress. Turmeric works great for oxidative stress. Absolutely. Yeah, I mean, really, you can hit turmeric across the board on. I mean, it works so well on so many different systems. It works on the pancreas, it works on the joints, works on the brain, works on the gut, works on the cellular level. NF-kappa beta is a cellular global signaling pathway. So if it works on that, it works on everything. So how do you know they got leaky gut? They crave carbonated beverage. They put hot sauce on everything, spicy food. They have to enliven their gut with bubbly stuff and spicy stuff because their gut is dead. That's why. Got it? They're slow starters in the morning. These are people in the morning, they are slow. And they typically are more anxious. They would rather pull the covers over their head and go back into a cocoon and not come out. You know what I mean? So they're just like, forget that. I don't have it enough in me to face the world. So put out the fire. Again, there's our turmeric, boswellia, Enzicor. There's the blood-brain barrier, OPC, grapeseed extracts inside the Vitanox. These are all really phenomenal products. The Herbavital is resveratrol, guys. It's made from Japanese knotweed. That's a MediHerb. You'll probably be able to get these in Canada, I'm almost 100% sure, through ProMedics, a MediHerb distributor. Boswellia, for sure, I know you can get it up there. So, I put in just the straight raw research article because I want you guys to see if you plug this in, photobiomodulation through low-level laser, you'll get over 50,000 peer-reviewed medical research on how this affects the mitochondria. And I put this in here because MAPK and NF-kappa beta is what destroys tissues when it's inflamed. These are cytokine signaling pathways. And it shows here preconditioning. See, this says transcranial. That's why I put the little t. Transcranial low-level laser therapy protects blood-brain barrier and shuts off neuroinflammation. What did we just say was the cause of Alzheimer's? Neuroinflammation. So if you can shine this, what they're showing is if I shine this before I induce a stroke on you, the likelihood of you living is much higher if I pre-treat your system. And what they did is exactly that. They pre-treated it and they found the blood-brain barrier didn't leak anymore and the ischemia stayed isolated. It wasn't widespread swelling in the brain because they pre-treated the neural tissue with light, low-level laser. I don't know, that's pretty cool when you see it shuts off NF-kappa beta and all this other stuff. You know, really wild stuff. So clearing infection. So we're into module 2. So module 1, fix the leaky gut. We went over that. Module 2, clear the infections. I showed you a little bit with that purple light. Remember we found it in her spleen? We treated it right there. Well, I'm going to show you how we do it with QI. I'm going to show you how we do it with biomagnetic pairs. And I'm going to show you how we do it with the violet laser. I'm going to show you how I stack it and how I clear it. Okay? So, first things first, are there, I asked this question to her body, obviously. Is there a burden of infectious agents? Like, is it even relevant? I'm kind of like shooting in the dark because what she told me about that same story, I was just like, yeah, well, maybe that sounds like kind of, yeah, okay, you were under some stress, but we know stress triggers the growth of adverse flora. I'm thinking like that. And we just checked. I scale it 0 to 1,000. 1,000 is the worst. So total system burden, how much stress are infections causing? Let's just see. 500. So it's more than 500. So right there we know she's a good candidate for this treatment, okay? 600, 700, 800, 900 out of 1,000. That's a lot, okay? Doesn't tell me what is infected her. It tells me this total system burden for infections. It's draining her system. It's stressing her system. Okay, so let's just see what pathogens. We'll check bacteria, virus, mold, yeast, fungus, parasite. None of that shows up. The category we didn't check, stealth pathogens, exotic infections is what I call it. That's where it's at. So that's where you got your Lyme spirochetes, you got your, I'm not saying you have that, I'm not diagnosing you. You have your stubborn mycoplasms, you have really weird, adaptable, Epstein-Barr falls in there, it's a virus. Really hard to kill, smart, intelligent viruses. She's throwing everything but the kitchen sink at them. So, what do we got to do? Oh no, I can't kill the pathogen. That's baloney. You can. Let's just check. Is there an area of biomagnetic pairs that we can do to start opening the immune system's eyes and bringing down the force field of these stealth pathogens? Is there or isn't there? I don't know. Yes. So, how do we do it? Show you the generic way, okay? Negative polarity first. So where are these infections high? Where do I need to place this to really make them vulnerable to immune system clearing so she can clear it once and for all? Okay? And I'm just checking. I'm just going over the body. So I found it right over her adrenal gland on the right. I would have never guessed that until I scanned, right? So what do? Some of these guys will actually tape these magnets on there, you know, and you don't have to do that, but right adrenal. Now that does not neutralize, that does not bring the field down. We need to find a positive polarity somewhere else to knock this field completely out, to neutralize it. So I grab the other side. Just be careful when you go over. If you're too close, it will jump and smash your fingers. My fingers have been smashed over the years. Lots.
You learned it.
I learned it. I'm a little slow though. All right. Is there a neutralizing polarity, this positive? Is there a point on the body that will, when I put it there, will neutralize these and really clear out these deep reservoirs of infection? You hear my intention? Okay. Right behind this scapula. Now, that tells me I could check tissues now that I know where it is. So what's behind the right scapula? Is it liver, gallbladder? No, it's too high. Heart's over on the left. What do you, huh? That's right. She probably breathed some crap in too, who knows? But it doesn't really matter because we place it there. Now sometimes if people really have multiple infections, sometimes, you know, I have a whole stack of these. Sometimes there's other positive polarity points distant from here that, you know, if you do that, it'll speed up the collapsing. So we'll just see, is there others? There's not. So these are your two core points, okay? That's great. That's biomagnetic pairs. The only other thing I do is I do a time. Is it 1 minute like this? Will that kill it, clear it? 2, 3, 4. So it's a 5-minute where these are sitting here, okay? So that's something that we can do. We can set a timer, we can leave. You know what I mean? Like we don't have to sit there and hold on to her. Oh, you're okay, we're clearing these infections. Just put it here and leave. Now, I can. I'm going to show you what I do. Yeah, I can. So second thing I'm going to do is see if there's an access point where I can kill it directly with violet light. So we'll check access points. So you could turn the violet light on, or you can just hold that intention. Is there an access point where I put this laser, I could clear the infection at its core? Okay, so let's just check. Violet, 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 violet. Nothing on the back. Is it probably in the viscera or on the front? We'll check. Again, the questioning would go like this if you had no laser. Face, neck, thorax, abdomen. So you see what I'm saying? Face, neck, thorax, abdomen. Do I need to flip her over and start poking at her gut? No. I'll knock my magnets off and it'll disrupt my whole process. So what I typically do, if it's in the abdomen, I do it into quadrants. Is it on this left half, right half? Is it the lower right quadrant? Upper, lower, upper. What's in the upper right quadrant? Yeah, you got the hepatic flexure of the large intestine, so there's a bend in the colon there. There's the liver, there's the gallbladder. I don't know what it is. We can find out though. Is it gallbladder, hepatic flexure, liver? Liver. What frequency am I going to use? Maybe liver. I don't know. Maybe it's an infection frequency. I have a Lyme frequency in here. Maybe it's a Lyme frequency. I don't know. We can find out. So, immune, infection, lymphatic, none of those. Cytomegalovirus, none of those. Detox, none of those. Candida, none of those. Lyme frequency for the laser shows up. I angle this up because I'm going to shove it under her body and laser her liver. Okay? This might be. You okay? Mm-hmm. Okay. So I'm blasting her liver while I'm doing this. Okay. Notice I didn't get into herbs. I didn't get into whole food supplements. I didn't get into homeopathics to clear this stuff. I didn't get into any of that. Systemic immune upregulation with nutrition. I haven't done any of that. All I've done at this point is biomagnetic pairs, low-level laser. I haven't done anything else. I will show you the QI method, okay? And what we've done already is isolated that there's pathogens, probably in the respiratory. It's fatiguing your adrenals. It's in her liver. So we know where they are. And we need to see, is there anything blocking the immune system from targeting, destroying, and safely degrading and eliminating these infections? Is there anything, and again, back to the QI template, is it physical block? Is it a physical block to getting rid? Why hasn't she gotten rid of this? This was 2 years ago. Why hasn't she gotten rid of it? Is it physical, chemical, emotional? So it's an emotional block. Great. At least we know it's emotional. And the emotion is, you're okay talking about me talking about emotions? The emotion is disgust. That's a stomach emotion. Disgust. Disgusted. I'm disgusted with this freaking RA, whatever this diagnosis is, right? Disgusting. Derailed my whole game. Right? Disgust. All right. So I found she needs the arthrostim. So this is my clearing point for QI. Her pelvis shows up, arthrostim. And what am I doing with my intention? Clearing the emotion. Take a nice deep breath. And relax. Disgust. Whoops. It's okay. Sorry about that. There's your magnet. Disgust.
Are you right in the middle of the sacrum, or where are you at?
Yeah, right on her sacrum. Yep. That's why they use masking tape. Because if they breathe or wiggle, they fly off. All right, so disgust. So are there any other contributors to her immune system targeting and destroying that? No. So once I find the major and I clear it, I then reassess what percentage of these infections have now been targeted by the immune system. Like, this is a very important question. We clear the interference. We've already shedded our intention that, hey, there's stuff in these regions. We're putting bioelectromagnetic fields to elicit this. We're doing a 405 nanometer, 635 nanometer laser to really bring attention to these areas. Well, now what, Mr. Immune System? We're shining a huge light on it. Like, how much have you targeted now that we've updated the system? I don't know. Are they 50% targeted? 60%? 70%? Her immune system targeted 80% of the stealth pathogens. That's great. That's not 100 though. So before I proceed, I always ask, is it safe for me to get her immune system to target all 100% of this population? And it is. She's giving me a big yes, her body's saying, yeah, let's knock it out. So what is blocking the remaining 20%? We call those ultra-resistant stealth pathogens. What is blocking the immune system from recognizing, destroying, and degrading the ultra-stubborn pathogens? Ultra-resistant. Is it physical, chemical, different cause, external, internal? Are there other infections? No. So sometimes other infections are blocking, playing interference, running interference, but that's not the case. For her, it's her endocrine system. Where do we place the first magnet? Adrenal. Okay, so if you don't have basic core energy, how are you going to clear out a nasty infection, right? All right. So endocrine. And what shows up is pancreatic glucagon. So that's when the blood sugar drops. The pancreas signals glucagon to release glycogen from the liver. So how that all plays, I don't have to figure all that out. All I need to know is, how do I clear glucagon? I need to adjust her right there. And it is a full-on toughness style adjustment, really low force. So I'll come in. So what's my intention other than clearing out the subluxation is clear out all interference related to blood sugar, glucagon, blood sugar going low, glucagon being secreted, whatever you want to think of as glucagon. Clear all glucagon interference. That's a generic blanket statement that works well. Or optimize glucagon, right? Like whatever floats your boat. Take a nice deep breath. And it clears. Now, her targeting was at 80%. Immune system targeting. Is it higher now? Yes. Is it at 85, 90, 95, 100% targeting? So I got through my QI method, step 1. I have a little secondary step that I've been doing that's been getting me even a little better results. Now that we've targeted that, what is the percentage of survival? Now that the immune system targets and is going to go to work, after it does its thing, what's the percentage of survival of that particular population? We want it to be 0. Is it at 50? Higher? Lower? So good. Lower than 50% is good. 40%, 30%, she's got a 20% survival rate. I don't like that. Not in a chronic state like this. How can I get the immune system's response to be very honed into those pathogens, but to be stronger to kill out the resistant 20? What do we got to do to improve immune system lethality? Is it emotional blockage, physical, chemical? So there's something chemical. Internal. Immune. What part of the immune system? Her memory cells. Isn't that something? Yeah, it makes so much sense. It's kind of wild. I don't know. I think it is. So where are we going to fix the memory cells? So she's over the right SI joint. So memory. We'll optimize memory cells, enhance immune system recognition, and lethality and virility of the immune system. We want it to be really like, bam, just that's tough 20%. Take a deep breath. All the way out. Clears. So, survival rates. We're 20%. How are your survival rates now, Mr. Stealth Pathogen? Post-application, are we now at 20, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. No survival rates. Fantastic. So, are these magnets 70, 80, 90, 100% cooked? They are 100% cooked. And the laser. We did 8 minutes right into her liver with the Lyme's frequencies. 4 different Lyme's frequencies right into her liver. Is this at 50, 60? This is only at 70%. And we'll see if we can speed it up. We can. Now let's check it, 70, 80, 90, 100. All I had to do is just bump up the... All right, so let's just see. We're at 70, 80, 90, 100. And that is how you combine, that's very advanced, okay? But that's how you combine QI with low-level laser with biomagnetic pairs. Okay, and did I even get into my nutrition? No. Do I even need to? Who knows? But on a follow-up, I might do nutrition on a different day. And if that infection point shows up, I will treat it. If it doesn't, I'll treat the weak link. A lot of people get screwed up. They go to these practitioners that are so bent on getting this infection. I gotta get that. It showed up on the blood. That must be the #1 system to treat because it showed up on the blood. These functional medicine people, they drive me bonkers. Oh no, it's right there in the Western blot. We're gonna do Lyme. What about the adrenal? Like when I test people, the adrenal shows up, the pituitary shows up. I go, you gotta fix that first. That's what the body's saying, do this first. I fix so many people from functional medicine by seeing what the body is asking for priority. Fix me first. And I do that, and it's amazing. I mean, I've seen people's blood work, everything change. Parasitology in their stool change. Never treated parasites. It's crazy. You can slowly sit up, Doc. You might be a little buzzed out from that. That was a lot. It really was a lot. Yeah, when you walk, you're going to be a little... If you fall on Dennis. Whoa.
I'm good.
Yeah, your legs are rubbery. Did you notice that?
Thank you.
She's stoned out of her mind.
Yeah.
That's great.
Really,
I love it. That's it's a muscle test. Any questions from all of that? That was like
So with regard to
everything.
priority, like in the basic QI method, you know, would you prioritize, do I need to go to an organ or gland before I go to the spine? Or do you tend to start the person face down and clear the spine, or?
Yeah, I typically, like on a day-to-day basis, I would go into finding where the major is along there, along face down. I'll do that scan that we did originally, prone scan. And then whatever the major interference is, whether it's physical, wherever that shows up on there, that was my contact point. And then I find the cause and I clear it. A lot of times just clearing the majors clear out a lot of the other stuff. You know, you don't have to get into a lot of intricate detail. I wanted to use her as an example because I had a feeling that there's some kind of underlying thing driving this because she's done so much already.
Right.
You gotta come out with like a different, like you were saying at the beginning, a better set of questions. Like, why is this? What's driving? There's got to be something driving this.
But I understand with her, but like
Yeah.
I'm saying, a more routine.
Yeah.
You like to start with the spine,
Yeah.
clear the spine, and
Yeah.
and then sometimes you won't even pick anything up, organ gland to do. Or,
No. Sometimes I clear that and they're good.
Are you familiar with Hansa Clinic in Kansas?
No. Oh, you know what? Maybe.
Again, he's doing
Maybe.
a bunch of Lyme stuff.
Yeah.
And he does some kind of bioresonance
Yeah.
scanning and everything.
Yeah.
It's pretty good work they're doing.
It's wild stuff. Like I see like so many similarities overlapping. Like these guys who did biomagnetics, they have no idea about any of this other stuff. They have no idea about 405 nanometer killing off Lyme. Like they have no idea about any of this stuff. Like he's like, man, that's that's all he does to kill this stuff. You see what I mean? Like that by itself is what he does, and he's successful. Like this guy who you're talking about, he probably has his, this is all I do and I get good success. You could be successful. I'm showing you like, hey man, here's like some of the best of the best. Pick, choose, combine, do whatever you want, but you have tools now. So I don't want people going in flat-footed and, oh, well, what am I gonna do with this patient now? I did everything I know how to do. Well, ask a different question, check them differently. We checked you differently, right? So, I mean.
Real good video or YouTube on the biomagnetic pairing too with Dr. What's her gas?
Duran,
Yeah.
Goyes Duran.
Yeah,
Goyes.
Anyways, he's in Spain and he's in a hospital and they picked this patient that has all kinds of blood work that shows pathogens and so forth. They use live blood cell analysis.
Yeah.
And he spends 30 minutes with the patient and they do the scan again. It's like close them away. They can't find anything.
Crazy.
And,
It's crazy stuff. Like I said, that by itself is crazy.
But
Cool.
in a lot of countries, he's become very popular in a lot of Latin American countries where they don't have the medication to
Right.
treat.
Right.
And he's identified 300 different pathogens from his work with
In his, it's interesting. Like his thing, he's a little different. He's a medical guy, so his pathogen work is funny. Like he'll say scapula, like negative, positive on the scapula. That's like for chlamydia. Tailbone, occiput is HIV. Like he has these points. Like, hey, I've done this so many times. If you put them here, that clears it. Like, and again, I don't know. I never tested his method. Like, I didn't say, well, I never checked to see what kind of pathogen. I've always done it like how I did with Nancy, which is a global. Where's the negative polarity need to go? Where's the positive polarity? And then clear it like that. I haven't gotten into like.
test that is pretty mind-boggling.
Is it accurate? Yeah, I'm sure, because he's went through however many years and done that. So hopefully, guys, that was helpful because that is really high-end, advanced. I've done the magnets on the brain. I've done, obviously, the laser. We laser the brain a lot. I've done it like that. Yes?
I was just going to ask you to talk about the PEMF.
Yeah, we're going to do that, hopefully, like last.
Oh, okay.
Yeah, I'll show you. Basically, bioelectromagnetic field. The magnets create a field. Like there's so much, like the strength, it gives you so much output on the field. That thing works in a very similar thing. It knocks the field out where these infections are hanging. So, and it's really stimulatory on the lymphatics. And I actually, for Lyme, I'll actually treat the spleen, the liver, and going back and forth between the spleen and the liver, and then I'll treat the gut directly. I mean, it's powerful. This works really well for the cases that I get. A lot of people with parasites because they're Amish and they're farmers and they just have a lot of parasites. And even the babies come out with pinworms and everything. So I get a lot of that. Zymex 2, and then month 2 you add the multizyme, so you do them together. And then month 3 you scrap those 2 and you go into the wormwood complex. That by itself knocks a huge percentage out, but for stubborn ones I've been using Parastat from Premier Research Labs and Paracid from Orthomolecular, Paracid Forte. That has an olive leaf extract in it. It's really potent, even for mold and mycoplasms and all of that. Actually, that first 3, those work good for mycoplasmic infections as well. Those 3, the Zymex 2, Multizyme, and Wormwood, I've gotten results with that. Liquid black walnut, if it's a fungal / parasite combo, the black walnut hull liquid from MediHerb is like rocket fuel. You can clear out serious fungal and parasite stuff at the same time. Very antifungal, that is. But yeah, play around with your testing menu.
So you continue when you add the wormwood, you're still using the top 2, or you stop those?
No, so you'll do 1 big bottle of Zymex 2, which I don't think they make anymore, unfortunately. They make a Zymex, I think it's a little smaller now. But anyway, I have them do a month of Zymex 2. And then on month 2, they do another month of Zymex 2. They're just adding multizyme with it. Stack it. Now, once they complete the multizyme Zymex 2, once it's empty, you go right into Wormwood Complex 2 and 2. And you don't pulse dose on Wormwood Complex. Dr. Carrie Baum will say you only do 10 days on, 10 days off. And let me tell you, for people who are chronically ill, you do 2 and 2 until the bottle's empty, and they will feel great. I did, when I was really sick with this, 10 days on, and I stopped it for 10 days because it said to do that on the box, on the bottle. And I felt so sick when I stopped. And I called Dr. White, and I said, it says 10 on, 10 off. He goes, you didn't stop, did you? I said, yeah. He goes, how did you feel? I felt horrible. He goes, then continue on it. I think I did Wormwood for like 8 months. I don't know. So he had me on it for a long time. But the point being is that the pulse dose for Wormwood, you don't have to worry about that. Artemisinin, I think there's some validity to that because your liver starts adapting and clearing it. You know, that Lyme protocol. All right. Fungal load. These are my favorite antifungals. CPEL is Weed Botanical. The rest of this is MediHerb and standard process. Candicid Forte, that's a orthomolecular. Lauricidin is from Sweden or Netherlands. It's a really, really potent monolaurin. They're like little pellets. Don't chew them. It's absolutely horrible. Or drink them with hot water. I made a mistake of doing it with a tea, and they dissolved in my mouth. Oh, you did that?
No, I didn't get it.
Oh, I gave them to you. Yeah, they're so awful if you chew or let that disperse. Let that stuff melt in your gut. It's amazing there. Caprylic acid, I talked to you about that. That's the C8 MCT oil, 8 carbon chains long. Fantastic. Antifungal. Obviously, if they have this too, you got to understand they have low nitric oxide, poor peripheral circulation. You want to get them exercising early in the morning to get the nitric oxide to be released into their blood and dilate peripheral circulation.
Somebody can't exercise.
Yeah, I have them, you can do like the Vibe plate. Dr. Jim uses the Vibe plate in his office a lot. His son Dave does too. Get him in water. If it's a pain issue, get him moving in water. If it's I have people just in rocking chairs, just rocking, just stimulating lymphatic flow. The key is not sitting stagnant. So introducing movement, okay? ADP is from Biotics Research. It's a killer. Emulsified oregano, it's awesome. I mean, it kills yeast off like crazy. Couple that with the FC-Cytal from Biotics. Those are another 2. If you have really chronic candida and yeast overgrowth, aside from starving off candida, not feeding it sugar, and starch and all that, and fruit, you could kill a lot of it. Probably 50 or 60% of them, ADP and FC-Cytal from Biotics. Those 2 are, well, they're wicked together. Really good. Told you about gut lining repair. If you can get standard process, here's a 21-day quick fix for leaky gut, if you can get it. Okay? Anti-inflammatory diet, you're taking out inflammatory grains. You're doing this the whole time, the probiotics. You're doing Cataplex AC the whole time, Enzicor the whole time. Day 1 through 10, you're doing the weed portion, even though you're feeding the whole time. And then day 1 through 15, you're doing chlorophyll, which is a vitamin K replenishment for sealing and soothing a leaky gut. So all of this is happening. This one will run out at 10 days. This one runs out at 15 days. And then you continue for the last few days, you continue just with these. Works great. Fantastic gut lining repair program. Okay. Talked about cytokines. Just shutting off cytokine storms. Inflammablocks. Fantastic. I have the herbs that are most powerful. I use these for Lyme patients. You can use them for anyone. Anyone in a cytokine storm feels awful. So first things first, Inflammablocks, Chinese skullcap. It's costly, it's expensive. It's also an Albizia complex from MediHerb, but way higher concentration there. You can get liquid tinctures of just Chinese skullcap. American skullcap doesn't work, period. Now I'm not saying it doesn't work for anything, it doesn't work for this. All right, look at the inhibition. Look at these cytokines that get shut off. Remember vitamin D increasing interleukin 10, which is really good for autoimmunity, shutting off autoimmunity. Look what this upregulates, interleukin 10. So there's something to vitamin D and skullcap to shut off autoimmune Hashimoto's, whatever autoimmune disease your people might be struggling with. And this is what grows where Lyme's disease is going rampant. This is Japanese knotweed. This is resveratrol. You want to help people out, put them on Herbavital or find some potent, ultra potent Japanese knotweed or resveratrol, super potent resveratrol. There's companies that have just knotweed extract. Premier Research Labs has a liquid resveratrol. It's all just straight knotweed extract. So some people need that potent of a thing. Herbavital works really well because it's combining other things like ginkgo and milk thistle. You can get that in Canada through ProMedics. It's a killer product there. Really good. Better than red wine, guys. I know you guys don't want to hear that, but the Herbavital is better. Cordyceps is another just mushroom that's so medicinal for inflammation. Huge for all of these different, I mean, look how many things get inhibited. Cellular Vitality has the highest concentration of Cordyceps mushroom. So Cellular Vitality is a really potent one for this. Okay, it's great for ATP production, mitochondrial function, but man, people overlook this and they shouldn't. SIBO, small intestinal bacterial overgrowth. SIFO is small intestinal fungal overgrowth. Dysbiosis is a term that describes all this. These are my favorite ones. The favorite test I have for SIBO, people when they do probiotics or kombucha, they bloat. They blow up like immediately, like the Michelin tire guy. You know who I'm talking about? Stay Puft Marshmallow Man from Ghostbusters. They blow up when they do. They're like, oh, the probiotics, I just blow up like immediately. Yeah, it's because you got massive bacterial overgrowth. Okay, a lot of these people will have really high folate in their blood because the SIBO pathogens excrete, they poop out folic acid. So they wonder why they're having toxicity. Is it, I taking too many B vitamins? No, these bugs are pooping that out. Their ferritin will be tanked, okay, because they're basically just being totally depleted. So you got to kill them off. Obviously the laser 405 kills it, but internally, the Golden Seal tablets from MediHerb and the garlic from MediHerb, those are my favorites. That dysbiocide FC cytal combination is probably my second favorite from Biotics, this last one here. Cal Ammo to acidify the gut. It's really good. Spanish black radish is awesome, especially if they have ileocecal valve dysfunction. Zymex, just what we put in the shakes today, that Zymex is great to feed the good bugs. How do you fix an ulcer? You adjust them. Ulcers heal faster when you adjust people. It's research. And just look at the research. It's in my book. But aside from doing that, high pep from Mediherb, it's German chamomile and meadowsweet. It'll heal ulcers so fast it'll make your head spin. If they're bleeding from their rectum, obviously get cleared for all the cancers and all that. So they're now classifying some of these as performance enhancers, because what they found was when they say the athletic event, your quads would blow out first, when you really push it. So they treated the quads, the mitochondria, with lasers, and then they went out and they usually hit the wall at 15 minutes, and now they're not hitting it until 30 minutes. So they're showing that like all that exercise-induced fatigue you offset when you load up the mitochondria with energy. They found if you load up the mitochondria prior to surgery, that you can do 2 knees at the same time. The one that they loaded up before surgery with laser had no pain, no need for painkillers post-surgery. Whereas this one was killing them. Why? Because you're changing cellular inflammation and analgesic signaling pathways. You're shutting them off. It's crazy, crazy stuff. So anyway, that's the red one. You improve learning and memory because of brain-derived neurotrophic factor. These are the guys you want to call. These little accelerates are normally 10,900. They're at 7,900. The PL Touch is one that has 2 diodes and 2 diodes. So it's like 2 of these, except it's in a little stretchy handheld thing, so you could place them. It's small. That one they're discounting from 13.9 to 12.9. The purple, they're going from 14 to 13. The base station, which has all 3, is actually the best deal because each of these are 8,600. So you get 3 lasers, 8,600 each. They do have financing too. The FX635, that's if you're getting really fancy. If you want to like really knock someone's socks, that's a full-on robotic. It's a giant robotic arm. They could sit their head in and it actually will treat 3 different brain regions at once. I mean, it's like wild. The lasers move, so it's as if you had someone, going and they're spinning this way too. But it's a huge mechanical thing. So I mean, if you want it, great. I would definitely have a business model in line before you get something like that. But these little handhelds, I tell you, been highly, highly impressive. Very impressive.